Mysuru. It's a great honor for me to welcome you all for the international webinar on Anushastra on behalf of Department of Shalyatantra and Shalakyatantra, JSSAMC Mysuru. As the saying goes, an investment in knowledge pays the best interest. And to begin with, today's first session of day 4, we have with us Dr. K. Sri Kumar, MS, PhD, Associate Professor in the Department of Shalakyatantra, Government Ayurveda College, Thiruvananthapuram. Sir was graduated from Government Ayurveda College, Thiruvananthapuram with University First Rank and completed MS in Shalakyatantra from the IPGTR, Gujarat Ayurveda University, Jamnagar with gold medal and PhD during 2011. And Sir won the National Ayurveda Scholar Award for the best PhD thesis. Sir is currently working as an assistant professor at Government Ayurveda College, Thiruvananthapuram. Now, the topic of this scientific session is relevance and practice of Agni Karma in Shalakyatantra. We are honored by your presence on this occasion, sir. Sir, all are invited to listen to you, sir. So please proceed with the session.
Thank you, Dr. Pooja, for nice introduction. So, I think the screen is visible to all of you.
Yes, sir, it is visible, sir.
Okay, so we are starting. Starting the session. So today's topic is significance and practice of Agni Karma in Shalakyatantra. Actually, we all know the Agni Karma is limited in Shalakyatantra, particularly in some diseases. So before going to the details, I would like to share few points regarding the basics of Agni Karma. So when we go through the textual reference, that Agni Ksharadapi Sreshtam Tad Dakthanam Asambhavat Veshaja Kshara Shastraischa Na Siddhanam Prasadhanat. Actually, it is mentioned that it is better than the Kshara Prayoga because Tad Dakthanam Asambhavat. That means if it is managed with Agni Karma, then it will not recur. In another reference from Susruta Samhita, it is mentioned that Ksharadagnir Giriyan Kriyasu Vyakhyada Tad Dakthanam Yoganam Apunarbhavo Beshaja Shastra Kshare Rasatyatvam Tad Satyatvacha. That means the same opinion as per the Acharya Vagbada, the diseases subsided by Agni that will not recur, and many of the diseases which are not curable by medicine, surgery, and alkali are curable by Agni Karma. Another important of Agni Karma in Shalya and Shalakya is that it is mentioned that one of the Rekta Stambhana Upaya, that means in Susva Samhita, it is mentioned that there are 4 methods to arrest the bleeding, that is Chadurvidham Edet Tadhi Rudirasya Nivaranam, Sandhanam, Skandanam Cheva, Pajanam, Dahanam Tada. That means Sandhana, Skandana, Pajana, and Dahana are the 4 methods of arrest bleeding, in which when we are referring the Nasagada Rektapita, all these methods are advised. That means in many of the nasal bleeding, this cautery is one of the best method to adopt for the homeostasis. And this when all these 3 methods, it is another, in another reference it is mentioned that Kalpereder Stirbir Vaidya Prayateta Edavidi Asiddhimaschu Chedeshu Daha Paramaisha. That means ultimate or maximum benefit of hemostasis is attained by the cautery. And when we assess the Agni Karma overall, we can see that the 2 benefits of Agni Karma, one is to remove the disease pathology and removing of this disease pathology without bleeding. So attaining the hemostasis and removal of these tissues both can be achieved by the Agni Karma only, and it cannot be achieved by the Kshara Karma. So this is the ultimate superiority of Agni Karma over Kshara Karma. And in another reference, Acharya Susruta mentioned that these are the Dahana Upakarana. That means the methods to adopt Agni Karma. That means Pippali, Ajashakrta, Godanda, Shara, Shalaka. I think all these are familiar to all. And mainly the Pippali, Shalaga, Kshaudra, Guta, and Sneha are practically used for Agni Karma purpose. And according to the site also, Acharya mentioned in Togdaha, that is Mamsa Daha and Sira Snayu Santyasti Daha. These are the three depth of the Agni Karma that we can adopt. That means Togdaha, it is a superficial bleeding, that superficial cauterization. Mamsa Daha, it is somewhat deeper, and Sira Snayu Santyasti Daha means it's still deeper. And in reference, it is mentioned that Tok Mamsa Sira Snayu Santyastistide Attigra Ruji Vayu Vritti Kadina Supta Mamse Vrane. So two pathology are mentioned by Acharya. That means Attigra Ruji. That means when the pain is maximum and if it is not responding with the conventional management, we can adopt this Agni Karma as an emergency one. And Kadina Supta Mamse. That means long standing thick and hard elevation of the mass, that in this condition also we can adopt the Agni Karma. And according to the site of Agni Karma, the Dahanopakarana are also explored. That means Tok Gadana, Pippali, Ajashakrit, Godanta, Shara Shalaka, and Mamsa Gadana, Jamba Oshta, Itaretara Loha, and Siras Nai Sandyasti Gadana, that is Shaudragota Snega. But in practically, we are most using Pippali, Shalaka, and Kshaudra, Guta, and Sneha. And in as per the opinion of Vagbata also, the same reference is available. And here also Acharya mentioned Arsho, Bhagantara, Grenthi, Nadi, Dushta, Vranadishu. That means the most of the diseases which is indicated for Agni Karma are Grenthi type or Nali Vrana type or Dushta Vrana are mainly. And in Shalakya also, this type of approach is advised. That means the diseases which is manifesting in the Grenthi Rupa or Nadi Vrana Rupa, for example, Danta Nadi, or Dushta Vrana Rupa, for example, that means Danta Mulagada Roga. All these are indicated for Agni Karma. And these are the general indication of Agni Karma. That means aggravated Vada, Granthi, Arsha, Arbuda, Bagandhara. All these are the general indication in which the Shalakya point of view, that means aggravated Vada, which producing the severe type of pain. For example, in Vadiga Shirashula or Ananda Vada or Anyado Vada type of presentation, we can adopt Agni Karma. Or in the diseases which is manifesting as Granthi, for example, Lagana, or in the form of Arsha, that means Vatmarsha or Nasarsha or Karnarsha, and in Nadivrana, that we have already mentioned, that in mainly in the Krimidanda or Danta Nadi, and in Shonita Dipravarti. That means it is one of the method to attain the hemostasis. For example, in Nasagada Rektapita as a Rekta Stambhana Ubaya, we can adopt the Agni Karma. And in a general aspect, in Mamsa Dhadu Vriddhi Jigalsa, it is mentioned that Mamsa Vriddhi Bhavan Rogan Shastra Kshara Agni Karmapi. That means if there is Visheshna of Mamsa Dhadu or Vriddhi of Mamsa Dhadu, the Agni Karma can be adopted without any hesitation. And the type of Agni Karma mentioned as Valaya, Bindu, Vilekha, and Pradisarana. And in many of these Shalaka diseases, we are adopting the Bindu type of Agni Karma. And these are the site of Agni Karma which is mentioned in Shalaki Roga. That means Tatra Shiro Roga Adhimantayor Bru Lalada Shanka Pradesheshu Dahed. Vatma Rogeshu Ardra Lektaka Pradichanam Drishtin Krutva Vatma Roma Kuban Dahed. That means in Shiro Roga and Adhimantha, the site indicated is eyebrows, forehead, and temple. That means the site is mentioned according to the condition. That means in Shalakya Tantra, most of the Agni Karma are indicated in some of the Shiroroga and especially in the Adhimanta. And another site that we can adopt Agni Karma is the Vatmaroga. And in Vatmaroga, we should take a precaution that ardra lektaka pradichanam drishti. That means the eye should be, that means the vision should be protected, or the visual apparatus should be protected before doing the Agni Karma. As we know, the drishti is a site of Pitta Sthana, so it should be taken utmost care to do not disturb the drishti while doing the Agni Karma in Vatmaroga. So when we analyze the Agni Karma in Shalakya, we can divide the indication of Agni Karma into diseases of eye, diseases of nose, disease of oral cavity, and a disease of head, in which the disease of eye include Vatmaroga and one Sandhiroga and Sarvakshiroga only. And the most of the Agni Karma is indicated in the Vatmaroga. And in Vatmaroga, the diseases are Lagana, Kristonmila, Arbuda, Pakshmobarodha, Bisavatma, Slishtavatma, and Upapakshmamala are the specific indicated Vatmarogas. And in Sandhiroga, that is only two, that is Puyalas and allergy. And in Sarvakshiroga, that means Sabishanda and Adhimanta are indicated for Agni Karma. So when we assessed all these factors, the major site of Agni Karma indicated in eye diseases are the Vatmaroga. This is because in the Samprapti of Vatmaroga, it is mentioned that Pradak dosha samastava yadha Vatma vyapasraya sira vyapyata avatishtande Vatma swadhiga murshida vivruddhya mamsam rektamcha tada Vatma vyapasraya. That means the diseases which is manifesting in the Vatmaroga having vivruddhya mamsam rektam. So as per the previous slide, we have seen that when the Mamsa Vriddhi occurs, we can do the Agni Karma with very safety. So the Vatmarogas are the group of diseases in which the doshyas are involved are Mamsa and Rekta. So both these Dhadu Visheshan can be managed well with the Agni Karma. That means if there is Mamsa Dhadu and Rekta Dhadu Vriddhi, we can attain the hemostasis as well as the removal of the Mamsa Dhadu with the Agni Karma only. That means the ultimate advantage of Agni Karma is that we can do the Mamsa Rekta Prakopa condition with attaining the hemostasis also. But in Kshara Karma, the Rekta Dushti will occur and it cannot be done in Rekta Dushta conditions. So the Agni Karma is very much important in the management of Vatmaroga. And in Vatmaroga, the main indicated disease is the Lagana. As we know, Acharya Susruta classified the Lagana into two diseases. That is, one is Alpa Lagana and another is Mahalagana. That means according to the chronicity and size of the manifestation, the growth, that is chalazion, especially we are referring the modern side, it is chalazion, can be classified into two groups, that is Alpa Lagana and Mahalagana. In Alpa Lagana Chikitsa, Acharya mentioned that after the Bhedana Karma, Rojana Kshara Tuthani, Pipalya Kshaudra Pratisarana Megegam Pinne Lagana Ishyade. That means after Bhedana Karma, Pratisarana is sufficient to manage the Alpa Lagana. But in Mahalagana, Mahantyabicha Yunjida, Kshara Agni Vidhigovida. So to remove the vitiated Dhadus, the Agni Karma is very much relevant in Mahalagana Chikitsa. So these are the pictures which showing the Alpalagana indication. The Alpalagana means it is having a small size, and with the Shastra Karma and Pradisarana we can manage it easily. But in Mahalagana Chikitsa there will be a lot of tissues will be there, and we cannot remove the tissues with the incision, and at that condition Agni Karma is very much needed. So this is one case that we have managed in our college. This condition, first, as per the classical reference, the Bhedana Karma is done with the chalazion clamp and vertical incision. And after that, removing all these pus, the thick granulation tissues or the remained tissues or the capsule of this chalazion is ultimately removed by the Agni Karma. This is a electric cautery, and by this electric cautery we can remove all these remained capsular tissues. And the main advantage is that by doing this Agni Karma, the bleeding automatically stops. This is the major advantage of Agni Karma. And this is another condition. This is a Vatmarsha, and within a look we can see it is having a reddish in color. So it is also having the Mamsa Rekta Prakopa, and in this condition the Agni Karma is the only procedure that we can adopt with the safety. And this is also another case of Vatmarsha, and this is also having a Vatmarsha which is manifested in the lower palpebral conjunctiva. And this is the electric cautery that we have applied, and after this electric cautery the bleeding is stopped and the complete was removed. So this is the main advantage of Agni Karma in Vatmaroga. That means in removal of the tissues and homeostasis, both can be attained simultaneously. And another disease which is mentioned for doing Agni Karma is the Cristoinmila. Cristoinmila is a typically Vadika prominent condition, and it is mentioned that uh, in Cristoinmila, as only Vada is involved, we can do the Agni Karma. Then Ashanto Mudgamatrandarei Pade Agnina Togdaham Bindubi Achari. That means Togdaha is indicated. That means if it is in the blepharospasm, then or in the condition which is only Vada is indicated, due to the Ushna Guna of this Agni Karma, we can tackle the pathology of Vata vitiation. And another condition is the Bisavatma and the Slishtavatma. In the classical text, it is mentioned that Bisa Slishtavatmano Tatha Anupashame Agnina Ksharenava Dahana. And is the next disease is the Upapakshma Mala. Upapakshma Mala is the distichiasis condition, that means development or growth of additional row of cilia in the place of meibomian gland. And it is mentioned that upapakshmani tu laksha rasena lakshayitva samdanshena udhritya tanu suchyagrena agni varnena roma kuban dahi. That means removal of this extra cilia with the forceps, and pinpoint cautery is mentioned here, and the same also mentioned in the allergy also. And this is the condition of distichiasis. You can see the additional growth of cilia in the place of meibomian gland, and the this additional growth of cilia will always disturb or irritate the cornea during the blinking process. This same condition is mentioned by Acharya Susruta as the Pakshma Kopa, and in the Pakshma Kopa, or the condition which is specifically mentioned in Vagpada, that is Upapakshma Mala, that both can be managed with Agni Karma. And this is the Pakshma Kopa Chikilsa. It is mentioned that Dehe Dashanto Nirbrujya Vatma Doshasrayam Valim Samdamshagena Adigam Pakshma Hritva Tasyasrayam Dehet Suchyagrena Agnivarnena. So in Pakshma Kopa and Upapakshma Mala, Pakshma Kopa means already present normal cilia which turning towards the cornea, whereas in Upapakshma Mala, an additional row of cilia is forming. So in both these conditions, we have to remove the irritating cilia with the help of Samdamsha Yantra and do the electrolysis or the cautery with the Suchyagrena Agnivarna, that is pinpoint cautery, so that the regrowth of the cilia will not happen. So this is the cautery that we are usually practicing for the pinpoint cautery purpose, that is the copper ball point cautery. So this is the procedure that heating the cautery up to red hot and then applying the cautery. So actually this is an electrolysis method, but we can adopt this copper ball point cautery to the base of the cilia, so that it will fall off from its root and will prevent the regrowth of the cilia. So these are the main diseases that we can adopt Agni Karma in Vatmaroga, especially all type of growth, irrespective of the uh, dhatu involved, that means Mamsa and Rekta Dhatu Visheshan, we can adopt the Agni Karma, and mainly the root of the cilia. As per the reference from the Susra Samhita, it is previously mentioned that in Shiroroga, Vatmaroga, and all type of growth, we can adopt the Agni Karma. So in next point of Agni Karma reference in Shalakya is the Sarvakshiroga. Sarvakshiroga means it is the uh, area which causing maximum pain in the whole area of eyeball and in the head also. So in Abhishanta and Adhimanta, it is mentioned that Abhishanta Adishu Bhru Shankha Lalada Desheshu Agni Karma can be done. And in Adhimanta, it is mentioned that Ashando Sarvada Manthe Bhruvo Rubari Dahid. Actually, in Adhimanta, it is having a severe pain as per the reference of Susruta Samhita. Utpatita iva chatyartham netram nirmadhyate tada shiraso artham cha tam vidya adhimantam svalakshnehi. Or in the Ashtanga Hridaya, it is mentioned that Adhimante yathasam cha sarve syanta digavada shankha danta kapoleshu kapalecha dirukara. So the both these conditions is having severe pain in the cause of trigeminal nerve. So actually in the condition which is not managed by the conventional treatment, we can adopt the Agni Karma as an emergency management to tackle the pain. So it is mentioned that Ashanto Sarvada Manthe Bhruvo Rubari Dahait. So these are the diseases which is mentioned in Sarvakshi, and in Santiroga, only one disease mentioned, that is Puyalasa. Puyalasa, it is explained as a Pillaroga, and it is mentioned that Puyalasetu Ashanto Sarvada Daha Sukshma Shalagya. That means after the removal of these tissues, this Puyalasa, it is actually it is a chronic dacryocystitis. So this granulation tissues and debris can be easily managed with the Agni Karma. And another reference is from the Drishti Roga. Actually, the Drishti is of Pitta Pradhana organ, and generally the Agni Karma is contraindicated. But in Vatma, Upakshma, Lagana, Linganasha, Asamyak Vedeshu. That means Linganasha, Asamyak Veda. If there is some complications in the surgery of Linganasha and the patient is developing severe pain due to that, then irrespective of the underlying pathology, we can do the Agni Karma. And another disease which is especially indicated for Agni Karma is the Arsha Chikitsa. And in Shalya and Shalakya, all type of Arsha are managed with Chadurvida Chikitsa. That means Chadurvide Arshasam Sadhanopayah Tadyada Veshajam Ksharo Agni Shastramiti. So in Shalakya, a lot of Arsha are explained, that is Vatmarsha, Nasarsha, then Karnarsha and Mukha. All these area the Arsha can manifest, and on all these conditions we can adopt the Arsha Chikitsa. That means Chadurvida Chikitsa, especially Veshaja, Kshara and Agni and Shastra. So of all this type of treatment having a specific indication. I'm not going to that detail. In Veshaja Chikitsa, Ajita Kala Jadani, Alpa Dosha Lingo Padravani, Veshaja Sadhyani. That means if it is of short-term duration, we can adopt the Veshaja Chikitsa. And in Kshara is indicated in Murdu Prasardani, Avakatani, Uchradani, Ksharana. If it is soft, we can do the Kshara. And in Agni Karma, especially Karkasha Stira Prudu Khadina Nyakinana. If the mass is rough, firm, thick, and hard, then Agni Karma is indicated. And in Shastra, mainly in the Tanu Mula and Uchradani, Kleda Vandita Shastrana. So in Agni Karma is mainly indicated in Nasa, Karna, Arsha, and Arbuda. And in Nasa, Arsha, and Arbuda, it is mentioned that the Desha Arsha Arbudeshuja. That means first line of treatment is the Dahana Karma. And in Karnarshas also, it is mentioned that it should be managed less like Nasarsha. So this is a case that we have managed. The patient presented with bilateral thick chronic mass. That means it is a bilateral nasal polyp, and the method of Agni Karma is very much useful at that condition, because the removal of the mass is totally done by uh, pulling the mass and doing the cautery, that is electric cautery at the base of the mass, and it is a complete mass was completely removed. And the main advantage that while doing this excision, the homeostasis, means the hemostasis is attained, and there will not be any bleeding during the procedure, and we can easily manage the patient by doing this type of Agni Karma. So here in this condition, if we are doing the Kshara Karma, it will take a lot of time to completely remove this tissue. But with the Agni Karma, we can instantly remove these tissues without any complication or bleeding, or without any post-operative infection also. So these are the main diseases that we have practiced the Agni Karma in Shalakya Tantra, especially Netra Roga and Nasa Roga. And another group of diseases which is mentioned, indicated for uh, Agni Karma, is the Mukha Roga. And in Agni Karma, indicated in Mukha Roga, is having some sort of particular purpose. For example, the removal of excess fat. For example, in Jalarbuddha, the Agni Karma is indicated for removal of the excess fat tissue accumulated over there, and removal of deeper tissue and dead tissue. That means in some diseases like Dantanali or Krimidanta, this Agni Karma is indicated. So to attain the deeper tissue or removal of the deeper tissues and dead tissues, which is indicated. And mainly another area is to subside the severe pain. That means it is the general indication. Wherever the pain is occurs as a severe form, then the vishation of the Vata will be maximum, and we can do the Agni Karma. Just we have discussed in Adimantha or Shirashula. Here also we can do the Agni Karma if there is have some severe type of pain in the Mukha Roga also, and to arrest the excess bleeding. That means the Raktastampana Marga we can adopt here also, and in deep-seated dental abscess also it is very much indicated. And actually that we have discussed, then Medoja Oshtagopa, it is clearly indicated. That means Swinnam, Bhinnam, Vimedaskam, Dehet, Medoja Magnina. That means Svedana, Bhedana, and Vimedaskam. That means after removal of the excess fat, the remaining tissues which is left over there can be removed with Agni Karma. And in Jalarbuddha, and this Sakshaudara Karshanam Tikshnam Bhinne Shuddhe Jalarbude Avagade Adivruddheva Ksharo Agnirva Pratikriya. That means Avagada. If it is deep, then we can do the Kshara Karma, and if it is Adivruta, that means if the regrowth occurs after the excision of the Jalarbuddha, then Agni Karma is the main treatment that can be adopted. And another disease is the Shita Danta. Shita Danta means actually it's having some excessive sensitivity also. Svinnasya Shita Dantasya Pali Vilikitam Dehet Tailena Pratisaryacha Sakshaudra Khana Saindavi. So Svinnasya Shita Dantasya Pali Vilikitam Dehet. That means to arrest the severe pain. Then Shita Danta, the main problem is that the patient will feel the severe type of pain. So to reduce the severity of that pain, so we can adopt the Agni Karma. And in Adidanta, that means after extraction to arrest the bleeding, it means Anavastita Rektecha Dekte Vrana Iva Kriya. That means if after the extraction of the extra tooth, if the bleeding is not stopped, then the main procedure adopted there is the Agni Karma. That means excessive bleeding can be easily managed with Agni Karma. And in Krimidanta, that means Gudena Purnam Sushiram Madhu Chishtena Vadahet. And means in filling, that is the temporary filling which is mentioned in Ayurveda by the Guda and Madhuchishta. So the filling of this area should be done with the Guda and Madhuchishta, and the Dahana Karma should be done to place that filled material in its position for a long time. and it will reduce the inflammation as well as the pain also. And the another group of disease is the Danta Vidridi. Danta Vidridi means actually it is a gum abscess, and here it is mentioned that to remove the dead tissues, Agni Karma is very useful. That is Vidrido, Kadu Tikshna Rukshehi, Kavala Lebanam, Karshanam, Kaduka, Kushta, Vrishchigali, Yavodbhave, Srekshet Pagam, Hime Pakwa, Padio, Dahyu Avakatagaha. That means we have to do all the procedures to reduce the inflammation. If it is already attained an abscess stage, then we have to remove that pus material and do the Agni Karma to prevent the second recurrence or to prevent the abscess again to manifest. And in the Dandanadi Chikitsa, so the same Nali Roga Chikitsa is adopted here, and here also it is mentioned that to remove the granulation tissues is Dandanali Chikitsa. This Agni Karma is very much useful. That means some Shothu Vedaha Karyam, Shirasas Chadapachare Tata, Nadim Dantanugam Dantam, Samudritya Agnina Dahe. That means if actually it is a dental fistula, or it is a gum fistula. Actually, this fistulous tract should be tackled by removing that teeth which is associated with that uh, tract. That means Dadin, Dantanagam, Dantam Samudriti. That is removal of that teeth and tooth extraction, and do the Agni Karma in the left over track. So these are the main areas that the Agni Karma is indicated. Actually, I am not included many slides because this much of patients are not coming because the dental side is very much developed, and we are advising the patient as a emergency management to relieve the pain mainly in the Mukha Roga. And in the Shiro Roga, especially in the Vadika Shiro Roga Chikilsa, it is mentioned that Ityashanto Chale Daha Kafe Chesto Yadodita. That means in the Vadika Shirashula, the Agni Karma is indicated. Actually, in Vadika Shirashula, there it is the when we assess the Lakshanas, it may having the Vadika Shirashula associated with Pitta or Vadika Shirashula associated with Kapha. If it is associated with Kapha, then Agni Karma is of best. And if it is associated with Pitta, then Agni Karma should be done with precaution. And so it is mentioned that Ityashanto Chale Daha Kafe Chesto Etodita. That means if the Vata Kafaja Shirashula, we can do the Agni Karma effectively. And in Anandavada Chikilsa also, it is mentioned that a Vadika Shirashula Chikitsa can be adopted. That means in Anantavada, actually, it is a trigeminal neuralgia. So the patient may have some triggering sounds. Actually, when the patient will touch that triggering sounds or taking a bath or brushing, at that time this pain will aggravate. So by identifying these triggering sounds, we can do the Agni Karma in that area so that the triggering factor will not disturb further and the pain will be very much reduced. So in tackling the trigeminal neuralgia patients, if it is we are stopping the medicines like tegretol, and during the procedure of that nasya or snehavana or shirodhara, if the pain occurs as of sudden, then we can do this Agni Karma as an emergency management. So this Agni Karma can be adopted with Pippali or by the Shalaka or by the copper ball cautery. So these are the point. It is already mentioned that in Shiro Roga we can do the Agni Karma in Bru, Lalada and Shankha Pradesha. So in this site, by any method, a lot of Dahanopakarana are mentioned. By the available method, we can do the Agni Karma in the Bru Pradesha or Lalada Pradesha or Shankha Pradesha to relieve the pain which is associated with the headache. And the condition which is contraindicated for Agni Karma is the Shirakamba. Actually, this Shirakamba is an special disease which is mentioned by Acharya Vagbada. Here, Acharya mentioned that Vadavidaba Vihida Kambe Dahad Vina Karma. It should not be done in Shirakamba. Actually, it is because that in Shirakamba, the dosha, the Chalaguna and Urdha Gati of means Agni. Agni is having the basically moving upward, and Vada is having the Kampana Swabhava. Both this will be vitiated in this condition. So if we are doing the Agni Karma, then this Kambha Vyadi or the Shira Kambha may there is a chance to aggravate this condition. So it is clearly contraindicated in the Shira Kambha, and all the other conditions which is associated with the Vada and the Kapha, we can easily do the Agni Karma, and especially the disease in mentioned as the Anantavada or trigeminal neuralgia. It is one of the best method to relieve the pain. So I am hereby concluding my presentation. So we have discussed the area of Agni Karma in the ophthalmology, ear and nose disease, oral cavity disease, and headache. And in ophthalmology, the eyelid diseases that especially the Mahalagana and all type of growth, including the Vatmarshes, can be easily tackled with Agni Karma, and all the conditions which causing the pain, especially in the Sarvakshi Roga, mainly the Adimantha is the condition which causing severe pain, that can also indicated for Agni Karma. And in ear and nose, most of the conditions in which presenting there or in ear and nose are the polyp, and this, all the polyp can be managed with the Chaturvida Chikitsa, especially the Agni Karma is the main and immediately result giving procedure. And in oral cavity to remove the dead tissues or to reduce the pain or to reduce the remained dead tissues or granulation tissues, we can adopt the Agni Karma. And in headache, the main condition which is indicated for Agni Karma is the severe pain. So the condition which causing severe pain over the head and the neck and in the temples or Shankha Pradesha, all these conditions which are indicated for Agni Karma. For example, Anantavada and Vadiga Shirashula and Vadiga Shirashula having associated with Kaphaja Shirashula, we can we can do the Agni Karma as a best treatment option. So thank you all for giving me a chance to present over here about the Agni Karma, which that we have practiced in our clinics as well as in our OPD regarding the basic concept, and the area that we have practiced in our college. This presentation actually explored that area only, and any doubt or clarification is always welcome. Thank you.
Thank you, sir, for such a wonderful session, for taking time out of your busy schedule and to share your expertise with us. Sir, we have a question regarding the session. So, the mode of action of Agni Karma. So, can you please explain?
Actually, when we are going through the mode of action, my opinion is that don't compare exactly with that of modern science, because Ayurveda having our own pharmacokinetics and pharmacology, we should define this disturbance, how we are tackling that condition, that we can easily explain by the Vada and the Kapha dosha. That means Vada and Kapha dosha both having the Shida Virya. So the Agni Karma and the accumulation, that means that we have explained the condition where the Mamsa Vriddhi occurs or the Vada Vriddhi occurs, both that condition we can easily tackle with Agni Karma. I think all the Ayurvedic students and practitioners have known pain theory that we can adopt here. That means root of pain, how it is acting on the nerve endings. That a lot of reference are available in modern science, and in Adimanta. Actually, we have mainly doing the Agni Karma in Adimanta, and in Adimanta, the main condition is that the patient is having severe pain. So that tackle that severe pain to reduces only the symptomatic relief. The patient will get the symptomatic relief by that condition. Only the complete cure of this pain will not occur because it ashanto dehe. That means if you are continuing the treatment and the patient is developing a severe pain, in that condition as an emergency management, we are doing the Agni Karma, not as a complete treatment.
So another question is, can Agni Karma be useful in migraine?
Yes, actually, in migraine, it is the similar disease I mentioned in Ayurveda is the Arthavabedaka. And in Arthavabedaka, there are two conditions. It can occur as a Vadika or Vata Kafaja according to Acharya Charaka. But the main diseases, when we are comparing this disease with the modern pathology, this migraine occurs as a uh, pitta predominant condition. That means the patient in the pitta prakriti, or the patient having more tension or a young age, or the patient during the migraine will have the problems of visual hallucinations or flashes or floaters in the visual media. All these when we are assessing these symptoms, these are pitta predominant condition. So before doing the Agni Karma, we have to especially assess the patient. Means actually in the before doing the Agni Karma, so a general contraindication is there. Actually in pitta prakriti patient, if you are doing the Agni Karma, it should be very much cautious about the condition, because in many of the migraine there will be a triggering factor. That we have to identify that triggering factor. If that triggering factor is not at all associated with his own pitta prakriti or pitta dosha associated, then we can easily do the Agni Karma. So the migraine, if you are assessing in the Ayurvedic point of view, if it is Vadika or Vata Kavacha associated condition, we can do the Agni Karma. And in some other reference, the migraine is also mentioned as the Sannibhata disease, and the Pitta involvement is evident from the sign and symptoms. In that condition, we cannot do the Agni Karma. So the Agni Karma ultimately, the more than the disease, this Agni Karma is totally depend upon the patient's prakriti and the pathogenesis.
Yes, sir. Thank you, sir. Sir, and another question is there. So the location of Agni Karma in Adimanta condition.
It is mentioned in the reference itself. Ashanto Sarvada Mande Bruvor Ubiri Dahed. That means we are doing the Agni Karma just above the eyebrows. As it is, we have mentioned that in Shalakya, many of the Agni Karma that we are doing in the form of Bindu. So we are making multiple dots over the eyebrows, which should not be so much deeper, so that it will create a permanent scar. So the Tokdaha is most we are adopting here, and multiple dots of Agni we are doing above the eyebrows as an emergency management to relieve the pain. So before assessing the Adimanta, if it is an angle closure glaucoma, we have to do an ocular emergency management. But this is indicated Ashanto when we are doing the common line of management in Adimanta, and if the patient all of on a sudden develops the pain due to the aggravation of Vada, due to some disturbance in the sleep or dietary pattern or the nidana, that condition, the aggravated pain can be managed as an emergency management with this Agni Karma. For that we are doing the multiple dots over the eyebrows.
Thank you, sir. And another question is, what is the role of different Dahana Upakrama for different sites like Twak Mamsadi?
Actually, it is already mentioned in the reference itself. That means Siras Nayu Sandhyasti means it is having the severe Atigra Ruchi, and in Tok, that means it is growth. Actually, in Shalakya, mainly the condition that the two conditions that we have discussed here. First is the removal of the mass, and another is the means relieving the pain, and the third another condition is the removal of the granulation tissue. I think in Shalakya, these three are the main area that we are doing the Agni Karma. So in Togdaha, mainly to remove the dead tissue, it means the growth, extra growth, mainly the Patmarshas or any type of growth. we manifesting in the eyelid, we can do the Agni Karma. And in pain management, we are doing, but for this purpose we are mainly selecting the shalaga. The shalaga is indicated in the togdaha. I mean, and this pipali also indicated in the togdaha. And in deeper, if we want more and more heat, then we have to adopt the tailadaha or snehadaha, which is, I think it is mentioned in the kadara, like that disease which is mentioned in the snehadaha. But here mainly we are doing with pipali or shalaga.
Thank you, sir. Another question is from delegates. That is Shalaka available for purchasing? And
Ac-
they are asking for any details regarding Shalaka.
Actually, this copper ball, this I have shown one copper ball cautery. Actually, it is very, very useful in a home practice or in our regular OPs. It is very useful and it is very easy to do the Agni Karma with that one. And it is available in the online, only 500 rupees everyone can purchase, and it is very much useful. And Suchi Agrena Agni Varnena, that is many indicated in Pakshma Kopa or Upapakshma Mala, and in many of the conditions the patient will come as an extra growth of cilia which is continuously disturbing. At that condition we can easily appellate that cilia and do the copper ballpoint cautery. The main advantage is that the area of Agni Karma will be very much defined and pinpointed when we are doing with the copper ball cautery. And another all other type of shalaga, I think it is available in Mumbai. That all are mainly indicated in the general purpose. I think Shalya people can give more reference regarding the availability. And here in Shalakya, we are mainly using the heated pipali, copper ballpoint cautery, or the Agni Karma Shalaga. The Agni Karma Shalaga mainly used, that means the broad-ended Agni Karma Shalaga is mainly used in the severe pain which is manifesting in the trigeminal neuralgia only. All other conditions in the lids we are managing with the copper ballpoint cautery or electric cautery. I think electric cautery is very much easily available in all the surgical centers. Hello. I think I have cleared the doubt that you have raised.
Thank you, sir.
Okay, sir. I think I am audible. Hello, sir. Is there any doubt?
Yes, sir, you are audible.
Ah, okay, ma'am.
Thank you, sir, for your valuable answers. And looks like we have answered all the questions of delegates. Now I request Dr. Vivek, Assistant Professor of Shalakya Tantra, to conclude the session.
Namaste to all. I am Dr. Vivek, Assistant Professor, Department of Shalakya Tantra, JSS Ayurveda Medical College, Mysuru. Today we have a wonderful session, and we have resource person Sri Kumar sir with us. He has shared his knowledge with us in today's session. On behalf of 20, we would like to thank our resource person, today's resource person, Sri Kumar sir, for sharing the knowledge with us.
Thank you, sir. Thank you, sir.
Thank you very much, sir, for sharing the knowledge.
Santosh, sir. Am I audible, sir? Sir, am I audible, sir?
Hello.
Sir, you are
Hello.
audible, sir. Yes, sir.
Screen sharing permission kodi sir.
Sir, you are the co-host, sir. You can do it, sir.
Co-host.
I have made you as co-host.
Host disable
Sir,
participant screen sharing ಅಂತಿದೆ. ನನ್ನ ಲ್ಯಾಪ್ಟಾಪ್ ಅಲ್ಲಿ ಬರ್ತಾ ಇದೆ ಹಾಗೆ.
ಸರ್ ಲ್ಯಾಪ್ಟಾಪ್ ಯಾವ್ದ್ರಲ್ಲಿ ಲಾಗಿನ್ ಆಗಿದ್ದೀರಾ ಸರ್?
ಜೂಮ್ ಆಪ್ ಇಂದ.
ಅಲ್ಲ ಸರ್, ಅದಕ್ಕೆ ಏನಂತ ಇದೆ ಸರ್ ಹೆಸರು?
ಸೇಮ್ ಸಂತೋಷ್ ಕುಮಾರ್ ಅಂತ ಇದೆ, ಡಾಕ್ಟರ್ ಸಂತೋಷ್ ಕುಮಾರ್.
ನಾನು ಕೋ-ಹೋಸ್ಟ್ ಮಾಡಿದ್ದೀನಿ ಸರ್. ಕೋ-ಹೋಸ್ಟ್ ಮಾಡಿದ್ರೆ ಅದೇನು ಪರ್ಮಿಷನ್ ಕೇಳಲ್ಲ ಸರ್. ಡಾಕ್ಟರ್ ಸಂತೋಷ್ ಕುಮಾರ್ ಅಂತ ಇದೆಯಲ್ಲ ಸರ್, ಅದು ಕೋ-ಹೋಸ್ಟ್ ಮಾಡಿದ್ದೀನಿ.
ಅಲ್ಲ ಕೇಳ್ತಾ ಇದೆ ಸರ್.
ಎರಡರಲ್ಲಿ ಲಾಗಿನ್ ಆಗಿದ್ದೀರಾ ಸರ್ ನೀವು?
ಹೌದು, ಎರಡರಲ್ಲಿ ಇದೆ. ಒಂದು
ಹಾ,
ಮೊಬೈಲ್ ಅಲ್ಲಿ ಇದೆ, ಒಂದು ಇದರಲ್ಲಿ ಇದೆ.
ಹಾ ಸರ್, ಈಗ ಅದನ್ನು ಕೋ-ಹೋಸ್ಟ್ ಮಾಡಿದ್ದೀನಿ ಸರ್. ಶೇರ್ ಮಾಡಿ ಸರ್.
ಹಾ, ಈಗ ನಾವು
ಸರ್,
ಲೈವ್ ಅಲ್ಲಿ
ಫಸ್ಟ್
ಇದ್ದೇವೆ.
ಸೆಷನ್ ಶುರು ಮಾಡ್ತೀವಿ ಸರ್. ನೀವು ವಿಡಿಯೋ ಆನ್ ಮಾಡ್ಕೊಂಡ್ರೆ ಸೆಷನ್ ಶುರು ಮಾಡ್ತೀವಿ. ಲೇಟರ್ ಯು ಕ್ಯಾನ್ ಸ್ಟಾರ್ಟ್ ಶೇರಿಂಗ್ ಸರ್.
ಅದೇ ಈಗ ಎಲ್ಲ ಆಡಿಯನ್ಸ್ಗೆಲ್ಲ ಇದು ಶೇರ್ ಆಗ್ತಾ ಇದೆಯಾ?
ಹೌದು ಸರ್.
ಓಕೆ, ಅದನ್ನ ನೀವು ಆಮೇಲೆ ಮಾಡಬಹುದಾಗಿತ್ತಲ್ವಾ? ಹಲೋ.
ಹಾ ಸರ್.
ಓಕೆ, ಇದು PPT ಶೇರ್ ಮಾಡ್ಲಾ?
ಹಾ ಸರ್.
ನೋಡಿ.
ಸರ್, ಇಟ್ಸ್ ಕಮಿಂಗ್ ಸರ್.
ಬರ್ತಾ ಇದೆಯಾ?
ಎಸ್ ಸರ್.
ಬಿಡಿ. ಹಲೋ.
ಸರ್, ಎರಡೆರಡು ಒಟ್ಟಿಗೆ ಆನ್ ಆಗಿದ್ರೆ ಆಡಿಯೋ ಈ ತರ ಸೌಂಡ್ ಬರುತ್ತೆ ಸರ್.
ಹಾ, ಇವಾಗ ನೋಡಿ ಸರ್.
ಎಕೋ ಬರ್ತಾ ಇದೆ ಸರ್.
ಅದ್ರಲ್ಲಿ ಒಂದ್ ತೆಗೆದ್ಬಿಡ್ತೀನಿ. ನೋಡಿ ಸರ್.
ಹಾ ಸರ್, ಕ್ಲಿಯರ್ ಸರ್.
ಕ್ಲಿಯರ್ ಆಗಿದೆಯಾ?
ಎಸ್ ಸರ್. ಎಸ್ ಸರ್. Shall I stop sharing for a while, sir, so that we can start it later?
Okay, sir.
Yes, sir. We shall start the session, sir.
Okay, sir.
Yes, sir.
Om Shri Shivratri Shuraya Namaha. My humble pranams to the lotus feet. Myself, Dr. Divya, Assistant Professor, Department of Kai Chikitsa, welcome you all to the second session of 4th day of Anushastra 2020. The true sign of intelligence is not only knowledge, but also imagination. As Albert Einstein rightly said, to mark real advance in science, creative imagination is required to raise new questions, new possibilities, to regard all problems from a new angle. Today, we have a surgeon with a creative imagination who made an update in Agni Karma. I welcome Dr. Santosh Kumar M. Arjunagi, Professor and Head, Department of Shalyatantra, SDM Institute of Ayurveda and Hospital, Bangalore. Welcome you, sir. Sir is an authentic person in Agni Karma as he is the brain behind the gas refilling small size Agni Karma Shalaka. And the more handy one, lithium battery chargeable Agni Karma Shalaka is known in sir's name only, Dr. Arjunagi's battery rechargeable Agni Karma Shalaka. Also, sir had published handbook on Agni Karma for practitioners of Agni Karma. Alongside, sir has got 19 years of teaching experience and expertise in Shastra, Anushastra Karma for 23 years. Sir had treated more than 2,000 anorectal patients and 1,500 spondylosis patients and managed various skin cases with parasurgical procedures. Sir has been a resource person in many national and international seminars and workshops. Sir was the first person to demonstrate live telecasting of Jalukavcharana and Agni Karma in Suvarna Kannada TV channel. Sir has also published articles depicting his clinical expertise. Being a socially committed doctor, sir extending free services to the needy through free medical camps and in association with NGOs. And a good doctor always show his social commitment even by an eye-opening research work. Sir has done one of such kind, survey of spondylosis due to bad road of Bijapur, attending the OPD and IPD of Shalyatantra Department of ABS Ayurveda Mahavidyalaya, Bijapur. Sir, we are proud to have you as a resource person to speak on the topic pain management with Agni Karma. Welcome you, sir. Over to you, sir.
Thank you, madam. Thank you, madam. Good morning, all. Am I audible?
Yes, sir, it is audible, sir. Loud and
It's
clear.
clear, no, sir? It's clear, no?
Yes, yes, sir. Yes, sir.
Okay, sir. Okay. By putting my namaskara to holy fetus Sri Shivratri Deshi Kendra Swamiji and Sri Manjunatha Swamiji Dharmasthala. Om Dhanvantri Namaha. I am very thankful to the JSS Ayurveda Medical College, all the team members of this webinar, including Dr. Principal Sarvesh Karji, Dr. Woodpudi, and Aradhya Doctor, and Ayan Goda Doctor. It's my privilege to share my experience with the Agni Karma, not only in the day-to-day practice, even in the situation of pandemic, that is COVID-19, because everybody is facing a lot of problems to deal or to interact or to communicate with not with only the patients, with the healthy persons also. Because COVID-19 says keep distance, keep away from yourself from a person. So that is one of the biggest issue in the medical field. When you are keeping person away from you, being a doctor, it's very difficult to do the examination, do the interaction, and come to a conclusion or diagnosis. Not only the diagnosis, it's very difficult for Ayurvedic people to take the patient for the treatment aspect, because we depends upon the maximum in the Panchakarma procedures. So Panchakarma procedures are very difficult without making contact or communicating with the patient. As a rule, the WHO says we have to keep the patient, or we have to keep the person 2 feet up or 4 feet away from each other. So that distance is not possible during in the medical field. So we have made some easy method, or the method which we are following in the treating the patients with the Agni Karma procedure, even though during in COVID-19 pandemic. We have fear in this period when our therapist, or when our assistants, or when our helping hands comes in contact with the patient during the procedures, we're also having so many questions in our mind, because nobody knows what type of patients will come to us. Even though taking a lot of precautions, we fall in trouble, and even our assistants, our helping hands will fall in trouble because of the COVID-19. So we should not leave the mankind suffering with the suffering. So we have to have, we should become a helping hand. We should become moral supporter during this situation for all types of patients. So when we have gone through all the Panchakarma department has stopped the treatment in our hospital, so we have started our Agni Karma with all precautions for the pain management, especially because patient comes with the pain management in the Ayurvedic hospital most of the time. Not only as the Acharya says, many of the diseases cannot be treated in this situation. Few of the diseases can be treated with the help of Agni Karma. So some of the videos we have made here to make easy for everyone, and they can perform Agni Karma in their day-to-day practice without fear of the COVID-19. Before going into all that videos, as usually, I have attended the morning session in the Shalakya department with the same topic, Agni Karma, in the Shalakya disorders. So elaborately, we have to go through the classical references, and not only in this situation, since the last 20 years, what we have done in the field of Agni Karma with the instruments. I would like to share all my experience and the slides and the videos to make everyone feel comfortable while practicing Agni Karma procedure. It is not a difficult one. It's a very easiest, simplest method that can be practiced even in the small setup like clinic. You don't need to have a bigger setup like Panch Karma. All other equipments and the instrument not required to practice Agni Karma. So now onwards, I'll go through all my slides. Once again, I would like to thank everyone, those who have given me opportunity to share my knowledge, including Principal Sir Dr. Sarveshkar and the Department of Shalya Tantra, JSS Ayurveda Medical College, and the whole team which are working front and behind this webinar. And I also wish all the team members this webinar has become successful, and it's a very great event for our Ayurvedic people. Thank you one and all. I will go through my slides. Dr. Ayan Gowda sir, shall I go through my presentation? Ayan sir, Dr. Ayan sir, can you hear me? Hello. 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 Can you hear me? Ayana sir.
Sir?
Can you hear me?
Sir?
Voice clear idea?
Loud and clear, sir.
It's audible?
Perfectly, sir. Audible.
So clear ಆಗಿದೆಯಾ?
Sir, clear ಆಗಿದೆ sir.
Okay, ನಾನು ಕಂಟಿನ್ಯೂ ಮಾಡಲಾ?
Please, sir. Please, sir.
ನಿಮ್ಮ ಕಡೆ ರೆಸ್ಪಾನ್ಸ್ ಬರ್ತಾ ಇಲ್ಲ, ನನಗೆ ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ.
ಇಲ್ಲ ಸರ್, ನಿಮ್ದು ಫುಲ್ ಸೆಷನ್ ಮುಗಿದ ಮೇಲೆ ಕ್ವಶನ್ ಆನ್ಸರ್ಸ್ ಬರುತ್ತೆ.
Okay, then fine. Thank you, sir. Thank you.
Okay, sir.
So we'll go to our presentation. So this is the before going to the mainstream, I would like to share a few of the pictures which have came into the newspapers. So this picture says children battle for life amid superstition. The unscientific treatment it's done or practiced in the northern states of India. There is a sitting sadhu, and the child is crying here. On the back of the child, the red-hotted rod was applied for some of the treatment. Just to see the picture, then go to the next picture of paper cutting. That is a healing with the heat. With the heat therapy, some of the diseases are treated. And this is one more paper cutting is there. That is a statistical statement of knee replacement in India is needless. And the study says it's unnecessarily the surgeries are carried out, about 35 to 44% in India. So knee replacement surgery will be done for the knee pain. Okay. So this type of knee pains can be eradicated or brought down with the help of different procedures of the Panchakarma as well as the Agni Karma. So this is one of the statistics which it says and tells the total involvement of the orthopedic department in India, how they are pulling the patient towards their surgeries when it is not needed. Then we will come back to this, our mainstream, Agni Karma. As usual, everybody knows, and many of people are practicing Agni Karma. So Agni Karma means, I will share the few slides with our classical statements. Agni Karma means where the Agni is used, or where in which the procedure is involves the Agni or the burn is done. That procedure is called as Agni Karma. Means Agninam Kurtva Yat Karma Agni Karma. Agni Sambandhino Va Yat Karma Agni Karma means wherever the Agni is used in the procedure, or the procedure which is done by the Agni or fire, that procedure is called as Agni Karma. This is according to the Acharyas. Then as per the Sushruta, what is the importance or Shrestha of Agni Karma? He has given a very beautiful explanation and statement regarding the Agni Karma. Everybody has to remember what happens when the treatment done with the Agni Karma. It means that dagdhanam roganam apunarbhavat besaja shastra kshara sadhyanam tas sadhyatvat. It means that dagdhanam roganam apunarbhavat. It means the disease which are cured with the help of Agni Karma, they will never reoccur. That is one of the beautiful and strong statement regarding the Agni Karma by Shuddha Acharya. And again, the Suchitra says where the Veshaja, Shastra, and Kshara is not possible to perform, or the disease which are not cured with the help of Veshaja Karma or Shastra Karma or Kshara Karma, in such conditions, the Agni Karma can be adopted and that disease can be treated. The same Sanskrit shloka and the same statement is changed into the modern era people, that is the Hippocrates says in English words, that is those diseases which medicine do not cure, the knife cures. Try to understand the first line. That is which medicine do not cure, and that the knife cures means when the medicine fails, surgery has to be adopted. And the second line, those which the knife cannot cure, fire cures. It's very important. When the surgery fails, then you have to go for the cure of the disease can be cured with the cautery or fire. Okay. And the fourth and third and most important line is those which fire cannot cure are to be reckoned only uncurable or non-curable disorders. So this is the one of the strongest statement by Hippocrates, and the same shloka we'll get in the Sushruta Samhita. So that shloka has been copied by the Hippocrates, what I say, and here into the in the English language, that is the this was what I have given in the slide. So Agni Karma is practiced, or patient will take in different methods or different procedures. And I have divided the total, the whole Ayurvedic procedures or treatments into 5 categories, like Veshaja Chikitsa, Chara Karma Chikitsa, Rakta Mokshana Chikitsa, Shastra Karma Chikitsa, and Agni Karma Chikitsa. These are the only 5 methods through which we can treat the different types of disease in Ayurveda. So as the being a Shalya department person, the Agni Karma comes under the parasurgical procedure. That the parasurgical procedures are 3 in number. One is Kshara Karma, Jala Kavacharana, and Agni Karma. And Agni Karma is one of the important procedure, and it is forgotten ancient Ayurvedic treatment, and very less people are practicing, and because of the very short available knowledge or textual references are available, very less textual references are available, and practical applicability is also very less. And even though we struggle into get into the different types of instruments, it's very hard to understand what kind of instrument we have to use, and which type of instrument in which all disease can be used, and what are the action and modalities of the Agni Karma in different conditions. It's a very big ocean like subject. One need to go and deeper into this and start practicing it. Once you start practicing it, it will become very easy, and it has a very good result. It's an effective treatment and very economical one. No need to spend a lot of money, and can be done as an ambulatory treatment. Okay. And it has no complication at all. When you do Agni Karma, there will be no complication. But as I'm telling, you have to have a thorough knowledge of the procedure, thorough ideas of the disease and the areas of the procedure that has to be understood before doing the Agni Karma procedure. And the Agni Karma is practiced all over the world in a different name and different subject and different procedures. And in a different methods, the Agni Karma is practiced all over the world. Few of them I have made here, like as a folklore practice in the Dubai and the southern countries, that is called as Todam or strike branding, what we call, and a religious practice as a mudra in Indian religious, and therapeutic practice in village or rural side when you walk and see the people who practices Agni Karma in different disorders with the help of what you call small piece of bengals. They will heat it and they will apply that small piece of bengal over the affected part, like migraine, headache, back pain, joint pain, and deep-seated thorns that can be burned with the help of a small piece of bengals on that particular area. And even to control the furiness of the animals like bulls and dogs, the Agni Karma is given on the forehead of the animals and on the back of the animals. These are the marks can be seen in the village side. Okay, when we see the village and rural areas, these are the fury animals who will be given Agni Karma with the red hot irons on their forehead. That marks can be seen. And religious ritual practice like Tapta Mudra. So this is the one of the traditional method in the Brahmana or our Hindu, southern Hindu people. They used to undergo for Tapta Mudra practice in case of when the Ekadashi comes during the Ekadashis. Okay, And then in the Chinese traditional treatment, there is a method or there is a procedure in a different they will do with the different medicaments and the different herbal sticks they will take, and they will burn it, and that will be applied directly and indirectly on the affected part. That procedure is called as moxibustion. And that everything says that the Agni Karma is well practiced today in some or other form all over the world. Okay, so these are some pictures that says different areas how the Karma is practiced. It is not the Ayurveda what the Acharya Sushruta has said or what Bhatta said. So these are the pictures I have taken in the different villages of our Karnataka, and not only in Karnataka, all over the India, wherever we have traveled, wherever the Agni Karma is practiced in different names with the different instruments, and how it looks when it is done on the patient and the persons. The first is the child on the complete abdomen around the umbilicus. The sharp instrument was applied to increase the immunity of the child after the immediate after the birth. Okay, and second one is strike band in what we call in the case of liver disorders, in case of what we call spleen disorders, and in case of the abdominal pain. And the fourth and fifth are the again these are the small marks are there on the abdomen. These are also found in the over the abdomen. And in the same way for the headache, for the migraine, and for even in the case of fever, the Agni Karma is done according to the situation and the place of the disease. Okay, and one more slide says that is what you call WASP. It is one of the procedures in the UAE practiced. That we can see here there is a person is lying, and two people are sitting near to that person, and one is holding his hand and head, and the other person is heating the rod, and this heated rod is applied. So this is one of the traditional method and practice is done is seen in UAE. That process is called as WASP. What I want to say that the Agni Karma is not a new method. Agni Karma is not a difficult procedure. It was from the beginning, from the ancient area. It is people are practicing, and we have to modernize it. That is very important. Being an Ayurvedic doctor, and scientifically we have to perform, our procedure has to be done with statistical data, and some of the research we have to do on the Agni Karma. That is very important. So very small amount of our research work has been done on this. We'll come to that later in a few slides. Then this is, as I said, Tapta Mudra. This is ritual, religious ritual practiced in southern India. People will be seeing how it will be done during the Ekadashi, in particular mass or month of religious people. And this is the moxibustion, as I said, in the Chinese traditional method or procedure. This is also called as Agni Karma. And then we'll come into the directly the procedures according to the Acharya Sushruta, how the total Agni Karma he has explained in one chapter regarding the materials and the methods and the indication and the contraindication, and how to come or overcome with the complications, and how to practice the Agni Karma in day-to-day practice. Everything is given in detail in the Sushruta Samhita. Somewhere else, very small amount of hints are given regarding the disease and regarding the places. So we have to adopt all these equipments and the instruments in different kinds of procedures, and we have to have the elaborated study on this Agni Karma procedure. So this, in short, I will finish it because everybody knows. If I go on reading, it will become boring. So the materials like Pipalya, Shakruta, Danta, Shara, Shalaka, Jambo, Staitara, Loha, Chaudhar, Guda, Snehischa. These are the materials Sushruta has told, and that we have made in the 3 tables. Like Tvachagata level, the 4 types of materials can be taken. Pipali, Ajashakruta, Godanta, Shara, Shalakas, and Mausa Dhatu level, that is a little bit deeper than the skin level. If you want to burn or if you want to do the therapeutic Agni Karma, then Jambo, that is black stone, can be taken, and Itharaloha means that is different types of metals can be taken. Not only the Panchaloha, not only the Suvarna, Rajata, Shalakas, we can take any type of Loha for the Agni Karma in case of Mausa Dhatu level. Okay, and then the third category is that is made under the heading of Sirasnayu, Sandhi and Asti level the Pramana. If you want to do, then Shaudra, Guda, Sneha. These are the three materials can be taken in case of deeper structure level burn. That is Siragata and Snayuta and Sandhi level burn and Astigata Agni Karma. We have to take Shaudra, Guda, Sneha. Okay. So these are the pictures I have given here to understand immediately once we go through the classes. That is the first picture. So that is the Pipali. Then Ajay Shakrit, Godanta, Shara Shalakas. These are the materials which are available in ancient eras, and with the help of these materials, our acharyas have practiced the Agni Karma. Not only these materials, they have taken some of the stones which has the capacity of holding the heat for longer period. That is the Jamboster, and not only the Panchalo Shalaka. They have taken different types of metals like silver, platinum, palladium, gold. All these any type of materials or metals can be taken for the Agni Karma procedure. Okay, don't restrict yourself to the Panchalo Shalaka. According to the use and according to the methods, we have to select the, or we can take any type of metals. Okay, then the third group is Ani, Jagri and Sneha. This is Mausa, Sirasnayu, Sandhigata level type of Dagda. These are the materials can be taken. And Vagbot added Pichuvarti, Suryakanta, Madhuchista, and there are three materials are added by the Vagbata. Okay. Then when it is be done according to the Acharya, Sarvarteshu, Purya, the Netra Sharad Grishma. In Sharad Grishma, we should not do the Agni Karma. Apart from these two Rutus, any Rutus, Agni Karma can be done. In case of emergency, if you want to do Agni Karma in Sharad and Grishma Rutu, we have to have the Ataika Chikista materials we have to keep with ourselves. If any Pratyanika Chikista materials we have to keep ourselves, because if any complication occurs, we have to handle that complications immediately with the help of the materials. Okay, this is one of the statement given by the Sushruta. It means anytime you can do the Agni Karma procedure, and there is no restriction. But the basic principle is Sharad and Grishma Ritu should be avoided if it is possible. If it is not possible, in case of you have to need, the patient need Agni Karma, even though in Sharad and Grishma Ritu, being an Ayurvedic Vaidya, we can perform the Agni Karma in the Sharad and Grishma Ritu, but by keeping all other complication, handle the complication, we have to keep all the materials. Okay. So Sushruta has given the free hand here. All the Ritus, the Agni Karma can be done. Then what are the indications? There are several diseases are told by the Acharya Sushruta, and we have taken few of the diseases for our studies, and we are doing the procedure Agni Karma in day-to-day practice in our hospital with a few of the major disorders what we are getting every day in the hospital. For example, I'm going through here the shloka, that is the Tang Masa Sirasnayu Sandhi Astigata Atigra Ruja. Try to understand this line shlokas, first few words. That is where the Atigra Ruja is there, pain is there. The pain may be in the Sandhi Astigata will be there, Snayugata pain will be there, Siragata pain will be there, Mausagata pain or Toggata pain. Any tissue which has pain or any structure of the body which has a severe Atigra Ruja pain is there, in that condition, we can perform Agni Karma. That is the major first important statement or indication given by the Sushruta Samhita. So this statement we have taken into our research work, and all types of pain we are dealing with the only Agni Karma procedure, and we have succeeded by making the patient friendly with the Agni Karma procedure by introducing different types of shalakas and different methods of procedures in different disorders. We have made all the types of varieties of Agni Karma, and we are having good results, and we are successfully practicing the Agni Karma procedure in day-to-day our hospital work. Okay. Apart from this Atigra Ruja, and the Sushruta also says in Katina Sukta Masa and Runa Granthi Arsha Arbudha Bagandara Apachi Slipada Charmakila. You see here the Arsha Arbudha Bakandara Granthi. So in all these disorders, the cautery machine can be used. That is the one of the modern science gift is there, and in that cautery machine we can we can make ourselves wherever the possibilities are there, wherever less amount of cautery is required, there we can use our Agni Karma Shalaka. Okay, it is also we have used during our surgical procedures regarding the Arsha and Arbudha and Runa and Charmakila also. The normal our Agni Karma Shalakas are used here in our hospital. Okay, and then Tilakalaka, Antraruddhi, Sandhisira, Chedana, Nadi Runa. These are the common disorders where the Agni Karma is practiced. So these are the indication given by the Acharya Sushruta, and this picture says the pain is, we have taken pain as a main issue in the day-to-day practice, how the person has to overcome with the pain. There are different areas in our body which gives different types of pain, and all the pains are given according to the region and according to the structures, different names the pains are called. Okay, so that pain, how the patient has to overcome, whether the patient has to undergo for the only the medicinal procedure, or whether the patient has to undergo for the Panchakarma procedure, or whether the patient really requires the surgical intervention to come out with their pain. And so these are the confusions are there with the patient. And one more, as I am telling, the Agni Karma is there, whether the patient has to select only Agni Karma. So which one is the standard one, which one is has very good result, and that is dilemma is there among our Ayurvedic field, Ayurvedic paternity. But as being an Shalatantra expert, I say Agni Karma is one of the easiest method, ambulatory treatment. There is no surgical intervention, and that can be done very easily, and it's very economic when it compared to the Panchakarma and surgical intervention. So when economical condition comes, we have to select Agni Karma or start with the Agni Karma only, and we have got very good results by applying Agni Karma in different types of pain and disorders of the joints and the bone and joints disorders. Okay. And according to the Ayurvedic part, the place of Agni Karma, Sushruta says in Sirogata Roga and Adimanta type of disorders between two eyebrows and the frontal and temporal areas, the Agni Karma can be done. And in case of the disease of eyelids, trichoma, the roots of eyelids has been advised. And in painful conditions, as I am highlighting and stressing more on this point, in painful conditions, any type of pain, at the site of maximum pain, tenderness, the Agni Karma is indicated or advised. And in case of the fourth one is a little bit controversial statement is there. We have not yet tried a few of the times we have tried to what you call to cure the inguinal hernia only by application of the Agni Karma, and somewhere else we failed it because of the practical knowledge. Still we are going on the little bit different methods and research work on this disease, that is inguinal hernia. Sushruta says on the first toe of the leg, opposite side of the body. Okay, in case of inguinal hernia, if inguinal hernia is on the right side, we have to do the Agni Karma on the left leg. If the inguinal hernia is on the left side, then opposite side, that is the right leg, we have to do the Agni Karma. This is one of the statement given by the Sushruta, and somewhere else we have not got a 100% result, and we don't know why we are not getting the results, whether we are failing to perform Agni Karma as per the wish and will of the Sushruta. We don't know, but we are not living it. We are again, because once we succeed in this, we can totally stop the surgical intervention towards the hernia. That is very important. It become a challenging for everyone, and it's a very new method. If we become successful in treating inguinal hernia with only Agni Karma procedure. The work is going on. Once it comes out, definitely we'll share all that videos and the photos and the research work with everyone. Okay. So all these places Sushruta has said, and after avoiding the and confirming the side of disorders, the person where we need to do Agni Karma in that particular areas by avoiding all these marmasthana vital part, we have to perform the Agni Karma. Okay. Then in which all conditions or patients we should not do according to the Sushruta Samhita. Patients are having patient is having Pitta Prakriti 1, Anta Shonita, Binna Kosta, Anadruta Shalya, and Aneka Runa Pidita person, we should not do. Agni Karma. It's a very basic. Already patient is suffering and already patient is having Pitta Prakriti. And if the internal abdominal or pelvic bleeding is there, in such conditions, we should not do the Agni Karma because patient is already in the trouble and in the complicated condition. Even in that complicated condition, if you do Agni Karma, again he will fall deeper problem. So that's why the advice don't touch all these patients. Avoid Agni Karma in such conditions. And second is like in Balaka, Ruddha, Durbala, Bihiru, and Asveda people who should not perform. It's one of the unaccepted procedure commonly when we explain procedure to the patient in our hospital. No, first time they will deny it because they will be surprised when we show them the shalaka when it become red-hotted. People never accept it when we say the thorough explanation of the procedure. Okay. Then the Hana Visheshata, there are different what do you call types are Vedas are given by the Acharyas like Tatra Vale, Bindu Vileka, Pratisarnani, Iti Dahana Vishesha. These are the patterns are said by the Shushruta, and not only the Shushruta, and even the Ashtanga Hridaya, Vagbata also added a few more things on this. That is the according to the Akruti, what you call. So Agni Karma types are like Valaya type, we can perform Bindu type of Agni Karma, we can perform Vileka type of Agni Karma, we can perform then Pratisarana type of Agni Karma, then Ardha Chandrakara, Ashtapada, Swastika. These are the patterns, these are the different patterns, the instrument, what you call, pointers we have to make here, or but we cannot find the particular detailed reference for all these akrutis, what the size we have to make, what is the length we have to make, what is the gap we have to leave in between the pointer and the handle and other parts of the instrument. If you, for example, if you take Asta Pada or if you take Ardha Chandrakara, what is the size of Ardha Chandrakara? Nobody knows, and we cannot find the direct reference for this. But when we have done a lot of work on this and we have made a different instrument which is having 4 pointers like Bindu Pramana, commonly what we are using all over the world and India, and we have added under 3 instrument or in 3 pointers like Ardha Chandrakara, Ashtapada and Swastika type of the shalakas we have made routinely to help the people to practice Agni Karma in day-to-day their life. So that is the one of the ancient instrument we have not left, that classical instrument what we call. This instrument can be heated on the normal flame, and that instrument can be used in different types of disorders. So there is a question comes where we have to apply this Valaya type of Agni Karma, or where we have to apply this Bindu type of Agni Karma, or in which all conditions the Ardha Chandrakara is said, in which all procedures or disorders the Ashtapada or Swastika is been explained. Regarding this, there is no explanation we have found in the classical textbooks. But as when the time passes, when we have gone through the different techniques and the methods, to practice these type of 4 pointers in different disorders. Okay, and for that we have made a beautiful instrument which becomes very handy and very smooth. Even the patient will also love that instrument. Okay. Then this is the one of the basic information regarding the level of the Dagda. Suchita says there are 4 types of levels of the Dagda is there. If you are doing superficial Agni Karma, that is called as Tvacha Dagda. If you are going deeper to the Tvacha, it is called as Masa Dagda. And deeper to that Masa level, Siras Nayu structures will comes. After Siras Nayu structures, Sandhi Asti structures will comes. According to that levels, the what do you call the Samyak Dagda Agni Karma Lakshanas said by the Sushruta. These are the Lakshana which you will have to attain during the procedure. That is Tatra Shabda Pradur Bhao Durgandata Tok Sankosacha Tok Dagde. Tok Dagda means Tatra Shabda Pradur Bhava. When you are doing Tvachagata level Agni Karma, the Shabda Pradur Bhava should be there. Cracking sound of the bone skin should be there. immediately the bad odor comes, durgandhata. Then tok sankocha, sudden contraction of that particular burnt area of the skin will be seen. So this is the beautiful the samyak the lakshana at Prachagata level. So like that, Sushruta has given the different samyak Agni Karma Dakta Lakshanas according to Dhatu. In case of Mausa, what type of the symptoms you have to get if you want to call it as a samyak Dakta. That is Kapota Varna, Alpashvaitu Vedanaha, Shushka Sankuchita Runita, Cha Mausa Dakta. This type of Lakshanas you have to attend, then only it is called as Samyak Mausagata Dakta Agni Karma. Like that, the Sirasnai Sushruta has given, Sandhi Asti Dakta Lakshanas has been given. These are the principles, these are the SOPs we have to follow according to the Sushruta. If such symptoms we are getting, first we have to plan what type of or what level we are doing the Agni Karma. According to that level, these are the 4 symptoms we have to get. Okay, that is very important. Unless otherwise it will not become success, or we will not get the 100% result. So this is the basic information of Samyak Agni Karma Takta Lakshana according to the Acharya Sushruta. Okay, so this is the basic. Everybody should follow this. Then only the success rate will be increased. Then we will go for the mode of action. It's very simple. According to Ayurveda, everybody knows Agni Karma is the having Ushna Guna, and it qualities against the Vata and Kapha, and definitely it pacifies the Vata and Kapha, liquefies the Kapha, and also controls the Vata, and whatever the obstruction is there, Shrota Avrodha is there, that will be cleared by the Agni Karma or Ushna Gunata. Once the Shrota Avrodha becomes clear, then it reduces the pain or it eradicates the disease. This is the basic principle of the Ayurveda. Okay, I will not go into detail in this regard, but as per our theory, as per our the vast 20 years experience in the Agni Karma, only we have studied regarding the pain management, how the pain can be controlled by only Agni Karma, how the Agni Karma works on the pain. It's very important. What are the centers are involved here? What are the scientific changes occurs in the body, affected person's body? How the pain will be controlled or pain will come down by doing Agni Karma? It's very clear and clean explanation we have given here, and this is what we have done during our 20 years of experience, research work, and we call it as a Dr. Arjun Gi's endorphin theory. Our name only we have given to this theory, that is endorphin theory. Everybody knows endorphin is one of the chemical which secretes from the pituitary gland. Pituitary gland is the one of the master gland which controls all the exocrine and endocrine glands in our body, and it secretes pituitary gland secretes endorphin. It's one of the chemical which controls the or which works as a pain relieving agent or pain relieving chemical. Okay, so how long increases the releasing and producing of this endorphin from the pituitary gland, that will subside the pain or sustain the exertion in the body. Okay, that is very important. So how we have to make the pituitary gland to secrete endorphin and release the endorphin in higher amount from the body, it's very important. That will be done by deeper stimulation. As everybody and even in the WHO, it is confirmed that by deep stimulation like acupuncture, that the pleasure center in the brain can be activated through the pituitary gland, that which releases the endorphin in higher amount. Then suddenly the pain will come down and the person will become very happy and healthy, and he feel very comfortable. So that is what the WHO says, and the same thing we have also done with the help of Agni Karma. When we do deeper stimulation with the help of the heated rod or heated instruments on that particular pain area, suddenly that stimulation goes into the pituitary, and this is a small gland through which the deeper stimulation, it becomes very active and it produces the higher amount of endorphin, and it releases the endorphin immediately, and that endorphin will come to that particular pain area, and the pain immediately subsides, not immediately within second, but as long as the quantity increases, as long as the endorphin comes to that particular area in the pain areas, the pain will subside. Okay, so we have compared the Agni Karma with the different techniques like the injection methods to analytic injections we have tried, and the Panchakarma different procedures we have tried compared with the Agni Karma. But as we have given a conclusion, when without intervention or without much investment, we can subside, we can control the pain by doing Agni Karma. How means that will going to stimulate the pituitary gland, and pituitary gland will secrete the endorphin in higher amount, then the endorphin will come to that particular pain area, and it will work as a morphine like function will be seen. So the patient will be totally taken out from the pain. So this is the theory what we have named as Dr. Arjun Gi's endorphin theory. Many people have given different types of theories regarding the Agni Karma mode of action, and as usual, we have not left the classical reference, that is the Ushna Gunata, and it is opposite of Vata Kapha, and as well as when the Ushna Gunata or Ushna treatment has been given for Vata and Kapha, definitely the Avrodha will be cleared from that Srotas, and that pain or Roga Marga will become very clear, and the doshas will flows in normalcy, and it will comes under the balance because of the controlling Vata and Kapha by Ushna Gunata. Then definitely once the doshas are become normal, maintains the normalcy, definitely the disease will comes under the control, and disease will become, the person will become healthy. Okay, that is the classical reference. We are not denying it. It's very simple, and it's a very acceptable statement or conclusion from the Ayurvedic part. But when it comes to the what you call explain the other people who are not other than the Ayurvedic field, they can understand, and they have to accept it, the endorphin theory. And this is what very strongly we are giving the statement, and because of our the thorough statistical research on this, that is the endorphin theory, which stimulates the pituitary gland by doing Agni Karma. Okay. Then how the procedures will be done? As usually everybody knows, all types of procedures in Shalya Tantra will be having three protocols, that is Purva Karma, Pradhana Karma, and Paschat Karma. So these are the three steps we have to follow. In Purva Karma, it's, since we are adopting Agni Karma, a little bit stress we have to take here, because once the patient comes to us, patient don't know what procedure you are doing and how you are performing it, and what are the equipments and instruments you are using here. It's very important to explain the patient. That is, preparation of the patient is very important. You have to explain about the Agni Karma procedure thoroughly and assure about the scar and gain his confidence. That is very important. You have to give assurance, because sometime in post-operative or post-procedure care, scar will be there. If the patient is female, they will be afraid of the scar. You have to explain the scar. It will subside in a longer period. After 6 months or 1 year, the scar will become normal skin color. That is very important. And second is explain about the procedure, what instruments and equipments you are using, how that procedure will be done to eradicate that problem. That has to be explained thoroughly. Then only the patient will accept you or your procedure. Otherwise, if you are forcibly or unknowingly, if you are doing, definitely you will spoil your name, and the patient will not come to you in the second sitting. And the follow-up is very important. Only one sitting is not required. You have to do multiple sittings. You have to call for the follow-up to the patient, and whatever the mistakes have been done, the beginners, what they do, the mistakes at the beginning, that will be rectified in the follow-up, and you have to study the case every follow-up time. Then you have to come to a conclusion where the problem is going on, if you are not trained well. Otherwise, if you are trained well, and if you are using the correct method, and you are using good and accepted equipments, then no need to worry about the results. Sometimes same disorder will take multiple sittings. Sometimes only one sitting is enough for the one disorder. So about the sittings and the follow-up is very important. You have to tell the patient it requires 2-3 sittings. That is very important. You cannot assure that in one sitting you will bring his problem under the control. It's not possible sometimes. Okay, so that is what the Purva Karma is very important. we need to work a little bit more here to make the patient accept our procedure. Otherwise, the procedure is very what you call difficult to perform. And once the patient takes it without his willingness, then the result will not be at the par what we are accepting. Okay. Then pradhana karma, you have to make yourself decision you have to make before doing the procedure, like type of Agni Karma, whether you are doing Snigdha or Ruksha, and then pattern, as I said, Valaya type you are selected, or Bindu Pramana you are selected, or Ardha Chandrakara, Astapada, Sastika, what type of pattern you have selected, that before only you have to make a clear cut idea and plan for that. And then identification of pain areas are very important, and mark that particular pain areas. All types of musculoskeletal disorders will be having pain at one particular area, or the whole part or organ will be having the area. You have to examine, you have to palpate, and you have to check it which is the more painful and which is the most what you call irritating to the patient. That particular area you have to identify and mark it with the pointers. Then do the procedure according to the Vadis, as Shrita said in the classics. Then Pashat Karma, immediate after the procedure, you have to go with the application of Kumari Sarasa to bring down the burning sensation and the irritation in that particular area. And then Haridra, with the help of Haridra, dressing will be done for the care of the wound of the Agni Karma. Okay, so this is how the Agni Karma method is followed in the 3 steps: Pura Karma, Pradhan Karma, and Pashat Karma. As I said, the Pura Karma is very important. You have to have little bit conversation and communication with the patient before doing the procedure. Otherwise, patient will not accept it. And what materials it requires, to don't have that bigger infrastructure. Only small setup what you have already in your hospital, like OP table, outpatient table. It requires Agni Karma Shalaka, different types of Shalaka you can keep, then gas and burners, then the Kumari Palpa, Haridra, Estimari Churna, dressing materials, marker pen, electricity point in case of if you are using electric Shalaka. Okay, these are the some materials, very few materials you require for the procedure of Agni Karma. Then you have to have, that is the important shloka, Rogasya Samsanam Apeksha Tamme Ganga Narasya Marmani Balabalam Cha Vyadi Tatartam. So this shloka says the person who is performing Agni Karma should have complete knowledge of Sharira Rachana, anatomy, knowledge of complete anatomy, not only the anatomy, Marma also, and then Balabala of patient, and Vyadi Sthiti, Vyadi stage you have to understand. Then you have to go for the Agni Karma. Otherwise, it will become reverse and it will spoil your name. You will trouble the patient, and patient will fall under the serious issues. Okay, and this is what I am telling in the last slide. We have made the 4 columns here, like Vadis, in which all diseases, what type of patterns we have to select. Then what are the places generally we do in every day in our hospital, and how many sittings in each disorder it requires. I have made a table-wise detailed description of each disorder. It's very simple and it's very easy to adopt and apply day-to-day practice for everyone. Don't fall into confusion. Don't get what you call make yourself application of Agni Karma into confusion status. Okay, very simple. We have made a table how the different types of patterns can be used, and what are the exactly a place we have to perform the Agni Karma, and how many sittings you require. You patient all the time they will ask you how many times you have to come for the follow-up. So this table will help you. And for example, 1 or 2 I will read here, because it's not possible to read all the disorders in short period. Okay, like in case of sciatica, the 3rd one I will read here. We have selected all the time Bindu type of Agni Karma Shalaka, and not only the Bindu Pramana, we have also selected the Astapada also we have tried here, and we have got good results with the help of Astapada type of Shalaka. Okay, then place of Agni Karma. In case of sciatica, where we have to perform the Agni Karma. Usually patient will be having pain throughout the course of the sciatica nerve. The whole length of the sciatica nerve has to be palpated from the low back to the tip of the toe of the leg, affected leg. So in that particular area, you cannot perform the whole leg Agni Karma. It is not possible. So that will become a bigger issue. You cannot do that. In the whole length, you have to what you call part by part or region by region, select the pain point, and that pain points has to be identified, and then Agni Karma is done.
Sir, network issue, sir. Santosh, sir.
Sir. ನನ್ನ ಡಾಟಾ ಮುಗಿಸ್ತಾನೆ 1 hour ಅಲ್ಲಿ.
ಇಲ್ಲ ಸರ್
You have reached maximum ಅಂತ ಬರ್ತದೆ.
ಬಂತಾ ಸರ್? ಗೊತ್ತಿಲ್ಲ
ನಿಂದು ಇದೆಯಲ್ಲಪ್ಪ ಮತ್ತೆ
ನಂದಿಲ್ಲ ಸರ್.
ನೋಡು ಕನೆಕ್ಟ್ ಮಾಡಿ.
ನಂದಿದೆ.
ಇಲ್ಲಿ ಬರ್ತಾನಲ್ಲ ವಿಡಿಯೋ.
ಹೋಗಿತ್ತಲ್ಲ.
ಸಂತೋಷ್ ಸರ್.
ಸರ್ co-host ಕೊಡಿ ಸರ್. ಹಾ
ಸರ್ ಮೇಡ್ ಯು ಆಸ್ co-host ಸರ್. ಹಾಗೆ
ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಬಂತು
ನೆಟ್ವರ್ಕ್ ಇಶ್ಯೂ ಇರ್ಬೇಕು ಸರ್ ಅದಕ್ಕೆ.
ಹೌದೌದು ಸರ್, ಪರವಾಗಿಲ್ವಾ?
ತೊಂದರೆ ಇಲ್ಲ ಸರ್, ತೊಂದರೆ ಇಲ್ಲ, ಪ್ಲೀಸ್ ಸರ್.
Sorry for the internet problem. It's not under our control, sir. So I'll continue. Sir, continue madla.
Please, sir. Please, sir.
ಇಲ್ಲ ಸರ್ ಟೈಮ್ ಇದಿಲ್ಲ ಸರ್.
ತೊಂದರೆ ಇಲ್ಲ ಸರ್.
ತೊಂದರೆ ಇಲ್ವಾ? ಓಕೆ ಓಕೆ. ನನಗೆ ಮಧ್ಯದಲ್ಲಿ ಡಿಸ್ಟರ್ಬ್ ಮಾಡಬಹುದು ನೀವು, ಏನಾದ್ರು ತೊಂದರೆ ಇತ್ತು ಅಂದ್ರೆ.
ಇಲ್ಲ ಸರ್, ಪ್ಲೀಸ್ ಸರ್.
Okay sir, thank you. So this is where I have stopped because of the internet problem. This is not under our control. Sorry everyone. Apologize for that. With all precaution we have started our session, but without our knowledge it has been disconnected. We don't know. Somewhere else our student has helped here. Thank you everyone for waiting patiently, and we will go through the slide which I have made, as I'm telling, for everyone to use the Agni Karma with all confident. According to the disease, we have done the procedures. How we have done the procedure, what are the areas we have covered, and what type of the patterns we are used, and how many number of sittings it requires. Everything is given in these tables. So these are the slides I will share you in the later with the college authorities. The people who are not having idea about the patterns and the place and the number of sittings of in different disorders, they can collect it from the department of Shalatantra JC side of the college, and later on you can interact or you can ask the questions related with all these during this after the session. Not only the after session, I will be available all the time in the WhatsApp and the Instagram, and my many more videos are there in the YouTube channel. The channel name is Dr. Arvind Gee's Agni Karma channel is there. I will be keeping updating all my videos in the YouTube. People, those who are away from the Bangalore, they can watch the videos and they can practice the Agni Karma. No need to wait for anybody or any training and any confusion in the We'll go through my next slide. These are the disorders and the patterns of Agni Karma. The place, one more table is there. That table says even in the shoulder stiffness, tennis elbow, carpal tunnel syndrome, psoriasis, eczema, and the paralysis, and the corn, and the warts, and the musculoskeletal disorders like pain management. How and what type of patterns of Agni Karma we have to select, and the place where it has to be done, and number of sittings. We have made table here very beautifully, and according to, if you follow this table, definitely I assure you will be having very good results in all these disorders. Okay. Then what are these are the simple photo shows that this is the small setup or small equipments you require for performing each Agni Karma procedure, and it's a very economic one. Only one time investment is there for the Shalaka. Once you purchase the Shalaka, it will come for longer period. Unless you break it, it won't break and it will not dissolve. So this is the Shalaka. Don't stick on to the Panchakarma. Any type of Shalaka can be used for the Agni Karma. And this is a marker pen. Then the aloe vera, that is the Kumari Palpa is there. Then some of the Runa, Ropaka and Vedana Shamaka Dravyas are there. Then bandage materials are there. This is a small requirement needed for the Agni Karma procedure. And then Pradhana Karma and Pashat Karma, some of the videos are there. These are the pictures. Then we'll go to the videos. Okay. So this is the first picture. Says that we have talking with the patient, and then we have identified the pain areas. This is the marked the pain areas. Then Agni Karma should perform. Immediately after that, the Kumari Palpa is applied. Okay. So that is a sciatica patient. Then this is the ankle pain and knee joint pain, even in case of arthritis, even in case of spraying and simple pain also the Agni Karma should be done. So this is how the schematic diagram we have made here. The patient will come with knee pain, and sometimes you cannot find the pain areas. Patient will say all over the knee, circumferential of the knee, he is having pain. Then you will be in the trouble that where we have to perform Agni Karma. Either the whole knee has to be burnt, or the application of Agni Karma is done all over the knee joint. It is not possible. If you do the Agni Karma all over the knee joint on circumferential area, then it will become bigger wound and patient will not accept it. Okay, so that is why we have made the medial and the lateral ligament, collateral ligament areas and the patellar ligament areas. They are marked with the circular oval shaped black color marks are there. Then the red color dots says these are the points where you have to apply the Agni Karma. Okay, so this is the sciatica. This is the how the nerve course is there. And then the these are the four areas commonly the patient says the pain points. So these are the four areas we have marked here. These areas has to be covered, whether pain is there or not. You have to cover all the four areas in case if you found sciatica. If you diagnose it is the pain is sciatica. Okay. Then this is calcaneum spur. And in the calcaneum spur, not only in the heel, on either side of the heel, posterior and the lateral side of the heel, we have to perform Agni Karma. Only doing it at the base of the heel is not enough. You have to perform in the second sitting the posterior and the lateral part of the heel. That is also very important to bring out from the heel pain in case of calcaneum spur. Okay, this is the tennis elbow. This is the marked area. Okay. So we'll go to this is a migraine. How the in the migraine, no, in a different areas we can perform the Agni Karma. This is only in the temporal frontal area. The Agni Karma is extended, and in the second picture, not only in the temporal, little bit, not only frontal, little bit temporal area is also covered here in case of migraine disorder. Okay, so then what are the instruments required? So these are the some of the picture we have taken when we were into the research work of the Agni Karma. These are the old method and traditional method, and rural areas people are still they are practicing with the iron rods. These are the rods heated on the flame, and that rods will be applied. And this is a little bit modified rod which has the wooden handle. And this type of instrument we have found during our research work in other parts of the country, and this is how it will be performed. Okay. So if you are keeping these instruments in your hospital or the clinic, patient will never come to you, and they will not accept if you are putting the instrument on the flame like this. Nobody will call you as a doctor, and they will not come to your hospital for the treatment. And this type of treatment, they will run away from you. And these are the again a little bit modified instruments are there, and everybody knows that these are the triangular shape and the conical shape instruments are available in the market. And these also instruments are a little bit good to practice Agni Karma. Okay, again one more picture is there. These are the different types of shalakas. Again, we have found in different hospitals and the different areas in the Ayurvedic colleges. They are practicing Agni Karma procedures. Okay, then you required if you are keeping all these instruments, you need to have the setup like one gas cylinder you required and the stove you required. That is burner. So keeping stove and the burner in the hospital, it doesn't look nice, and no doctor or no hospital will keep in the OPD or in the treatment procedure this type of instruments. Okay, it is also annoying to the patient as well as to the doctor, and this is running into our mind whenever we come across with this type of problem. When the patient comes to our hospital side and the treatment procedure room, they will ask, sir, what you are doing with the cylinder and the gas stove in the procedure room. Then many a times we fail to convince the patient we are heating that particular instrument on this stove and on this burner, and that heated instrument will be applied to you. Then suddenly they will become shocked. Sir, what? These are the setup you kept in the hospital, and that instrument is heated on this. We thought it is an electric shock, or we thought it is a laser, or we thought it is a advanced instrument. So suddenly they will think and they will judge you in a little bit underestimate you, and definitely they will not come to you in the follow-up, and they will spoil your name when they walk out of your hospital. This is actually we had practical difficulties to convince the patient. It doesn't look nice among our fraternity keeping such thing. It is okay in case of panchakarma or setup, because patient also knows the oil has to be heated and the procedure requires the gas cylinder and the stove and all. But Agni Karma doing and keeping such things, no, it doesn't look nice, and people will not accept it. Sometimes it's very difficult to convince the patient. Okay, then what we did see, it looks how very dangerous when the chalaka is heated on the stove, in front of the patient, not only in front of the patient, even away from the patient. If you heat it and if you take near to the patient, definitely patient will not accept it. See, this is again either okay, you leave it gas cylinder and the burner. You can purchase one more online. A small tin will be there. Butane gas tin is there. It has a the burner is there in the at the tip. So with that help also we can heat the shalaka. But this is also doesn't look nice. Patient will not accept it. Definitely they will run away from you. Even the patient is having fear towards the injection. Even a small prick, sometimes patient will not accept the injections. When they are not accept the injection, that much sensitive people are there in front of you. If you are hitting the instrument like this and asking them to undergo for the procedure for their pain or their disease, no, definitely they will not come to you. They will run away. So these are the practical difficulties we have faced. Then being an Ayurvedic doctor, we have break our head. We are taught in different manner. Not only the Ayurvedic people, the whole universe has to accept our instrument and undergo for treatment. So we have become very smart to making different types of instruments like this lady. So we have worked on that and we adopted the Sushruta Samhita Yantra Vidya Adhyaya Shloka. That is how the yantra should look and how should yantra should be made thoroughly. The Sushruta Acharya has explained like Samahitani, Yantrani, Karaslakshana Mukhani, Sudrudani, Surupani, Sugrahani. That is a very beautiful line in the second. That is Surupani, Sugrahani, Chakaraya. It's very beautifully explained by the Acharya Sushruta. So this was we have followed wholeheartedly. Surupa, Sugraha. That is two things we have maintained in our making our Shalaka. That is, it's a trial and error. At the beginning, we have made Shalaka like this. Then later, we come out with the Shalaka with the three different parts. That is, pointer and the Shalaka, then the wooden handle. And these three are separated from each other. That can be fitted with the help of the screw. And we have given the finishing touch like a golden touch. It looks like a handy, very beautiful golden plated Shalaka we have made, because to encourage the patient, to encourage the people who are practicing Agni Karma, no, we have brought this instrument at the beginning. Somewhere else, again, it becomes a very bigger in size when we keep these instruments on the table. It looks very bigger and odd shape and size. Okay, that's why again we studied on that. We have gone through several trial and error in making a smaller instrument. So then when we gone through the pointers of the instruments, we have made 4 different types of pointers that can be changed according to the disease and according to the situation. That is Bindu Pramana. Here you can see here. And Ashtapada, second and third is the Swastik, and fourth one is Ardha Chandrakara. So these are the small pointers we have made, and that can be fitted at the tip of the Shalaka wherever it requires according to the disease and according to the condition. Any type of pointers can be changed and applied during the Agni Karma procedures. Only that the practical difficulty is that you should have knowledge of these pointers, where it has to be used, how it can be used, when it can be used. That is very important. You require a little bit practice on this, and for that, no, we have made a small book on that. That is Agni Karma Made Easy, and in that book, all the disorders and all the pointers we have given detailed description how it can be used and what are the sittings it requires and what are the complications and the adverse effects are there, and where these instruments or this Agni Karma will not have 100% results, where we can get 100% results. Everything is there in the text. Small hand book is there that will be available in the market in few days. Okay, so this is the final product of the latest instrument which has 4 pointers, very small one that can be kept anywhere, and we have given name that is Dr. Arjun gives Agni Karma Shalaka for this, because we have invented following the Sushruta and Vakpata Acharyas. It is not new one, only we have given the shape and size to that instrument and handy look to that instrument. See how it looks when it is opened, and when it is fitted to one pointer is fitted to the Shalaka after keeping all the 3 parts at one place, how it looks. Okay, so this is one of our invention, and it's a very beautiful one, and it's almost all the maximum people are using all over the India. Okay, and then when we fought with the problem with the keeping cylinder and the gas stove, we have made a small handy instrument which has a smaller cabin at the bottom of the instrument which contains a gluten gas webinar. We have a small new instrument we made, and at the bottom of the instrument there is a small tin is there which contains the butane gas, through which we can ignite the pointer of the shalaka. So that pointer will be get heated within 1 or 2 minutes, and that shalaka can be, after heating, this shalaka can be used. So here the butane gas is very important. Normal gas would not be filled here, and this is a refilling shalaka, very small pen-like structure that can be carried anywhere, and this instrument can be kept. It doesn't require any type of bigger setup like electricity. You don't need to have, and you don't need to have the gas and the burner in your department or in your hospital. Only the instrument is enough, which it has to be filled with the butane gas. That is very important. Okay. And this is one more instrument. It is the same butane gas shalaka. We modified in different say size and shape. And then after this butane gas shalaka, in some areas of our state, no, or in the India, like if you are going away from the main cities, if you are going in a taluk and a village place, you will not find the butane gas. So how this instrument should be refilled? It's a very difficult task for the people who are practicing with the help of this type of shalaka. Then we have made one more shalaka, like a phone, you know, how we are using our mobile phones. Once the mobile is charged in the night, and the whole day or 2 days the mobile is used anywhere, okay, without charging it. So that phone has a lithium battery in the setup, okay. So that lithium battery, same thing we have adopted in the shalaka. The same lithium battery is fitted into this shalaka. Once the lithium battery is completely fully charged, that can be used for 2-3 days, okay. So this lithium battery chargeable shalaka we have made, and it is a small different shape we have given to this. And at one point at the end of the shalaka, through this we can recharge the battery like mobile. Once it is fully charged, and there is a button, there is a on and off button is there. If you switch on this, the heat will goes to the pointer, and the pointer will get heated within 1 or 2 minutes. So this is can be used again anywhere, but it requires the charging cable and the charging pointer. Okay, so like a mobile, we can carry this instrument anywhere and any place. It can be used. It's very beautiful and handy instrument. This is also one of our invent. This is called as Dr. Arjun Gi's Agni Karma Shalaka. That is battery rechargeable Shalaka. Okay. Then we have presented a lot of papers on this research work regarding the Agni Karma and its effects on the pain management. We have got a very good response, and got a first prize in the paper presentation and poster presentation in the Dallas of Texas in 2016 at American Society of Interventional Pain Physicians annual meeting held in April 15 and 17 in 2016. Okay, in that, no, there are people are presented so many papers and so many research work on this pain management. So among all that, no, we got first prize. Our Agni Karma stands at first place, and this is well identified by the European and the American countries. So somewhere else we are having that problem to enhance the spreading of this knowledge to, away from the our country. But it's very difficult to convince our people in the country first. That is what we are facing problem. That's why we have made a lot of instruments, different types of instruments, and I hope in future the people will believe Agni Karma, and the procedure also will be having effective in all case of disorders, and the maximum people will be having starting using Agni Karma. With the different types of shalakas. Okay, so this is one of our achievement which we have got first place by putting our all the research work in front of the globe in the Ayurveda and interventional pain management. Okay, in the America, one of the beautiful achievement from our side. And this is the we have made small chart. It doesn't require for anybody. See, gold, silver, copper, brass, iron, people, Ajay, we have made the temperature, maximum temperature, how much longer they will hold the temperature. What is the degree of the temperature centigrade? We have calculated with the laser thermometer. So these are the degrees. Up to this level, the materials will get heated, and the affordability we have made here, like gold will be very costliest material that cannot be used every day, and all the physicians and the doctors cannot keep this instrument in day-to-day practice. It's not possible. Comparing all the metals, no, these are the copper is good, economic, brass is economic, and the iron is also economic, and these people and the Ajay Shakur, these are all economic. So when we say economic, that can be used when they have good results. Okay. So according to this, keeping the slides in your mind, we have made what I have said the instruments and the equipments. Okay, these are some pictures. We have done the Agni Karma in the cervical spondylosis, and this is the Gutenberg Shalaka. Then this is the Carcani spur. How the steps we have followed here. you have to you have to mark the pain points first, and then you have to go for the Agni Karma. This is the battery Shalaka is there. How deeply we are doing the Agni Karma. You can see some of the videos are there. I will show you the videos. Then this is the removal of the warts and the skin tags on the neck with the help of battery Shalaka. It's a very simple procedure. No need to send the patient anywhere from your either the hospital. You can perform a few of the things or few of the procedures in OPD level only. And then this is the tennis elbow. Videos are there. I will show you. This is the before treatment, how it is marked, and the after the treatment, the Agni Karma burnt marks are there. After that, the Pashat Karma, Bandhana Karma is done here. Then, sorry. This is arthritis patient. You can see the hand of the swan neck deformity in the patient. I will not telling here that we rectified the deformity, but the patient came for the pain management, and patient has been underwent for several treatment in modern science as well as in or Ayurveda Panchkarma department. We have very good coordination with the other departments, like whenever the patient is treated in other department for the pain management and some of the diseases, if they are not comes under the control, that people will refer the patient for the Agni Karma management, okay, or Agni Karma procedure for the pain management. That coordination should be required in all the hospitals wherever the other departments are working, like Shalakya and Panchkarma and Kaya Chikitsa. So we have very good coordination with the Panchkarma and Kaya Chikitsa people. Whenever they are treating the arthritis patients, when the pain is not coming under the control, that people, we are very thankful to that people. They are sending the patient to our department for Agni Karma procedure. We have done Agni Karma for the pain management in the arthritis, in the knee joint arthritis. The patient, this is the picture what after the procedure, and patient has very good results, and they walk out of the hospital with a happily without pain in case of even the Vadis, Asadhya and Kashtasadhya. Okay. So that my request is to all the other department people, whenever you feel the Agni Karma requires for the patient, you please refer the patient to the Shalatantra department for the Agni Karma procedure. This is one of the biggest coordination between the each department that requires in all the hospital and the teaching colleges. And as I said, the YouTube videos, lot of videos are there. I request all the participants of this webinar, please watch my videos, like and subscribe the video on YouTube. The channel name is Dr. Arjun Gi's Agni Karma is there. So many things are there in that. And then a few of the videos are there. I will show you. So this is the battery Shalaka. We have done how the procedure is done in the low back. First, we have identified, then the Shalaka is got heated. This is not battery, this is the butane gas Shalaka. Whatever you have seen in the previous other Shalatantra departments, the Shalakas are different and they are get heated on the gas burner. And this is very simple. In hand only you can heat the Shalaka. See that jerking of the patient, that type of deep stimulation it requires here. So that will stimulate the pituitary gland when you do the deeper stimulation. So the pituitary gland will secrete the higher amount of endorphin that will runs into that particular pain areas, pain path, and it works as a endorphin and morphine like function will be there, and pain will subside immediately. So the patient is having pain in the low back and on either side of the gluteal areas. The patient himself is telling he's accepted our procedure after doing the right side gluteal area. Patient is requesting us to do the procedure even on the left side. Okay, so left side the pain point is identified with the pen, then we will apply that Agni Karma. That is a Bindu Pramana type of Agni Karma is there. So repeatedly we have to examine the pain areas and identify. It's very important. See that mark that is Pachagata Dagda we are doing here. That sound you can hear. Sankocha, Shabda Pradurbhavo. So this is how the Bindu type of Agni Karma at Tvachagata level will be performed in case of low back or in case of sciatica. Okay. Then we will go to the tennis elbow. This is before COVID what we have done in so many years we are doing. So this is battery shalaka. The previous one is a butane gas shalaka. This is battery shalaka. It has a on and off button. You have to switch on the shalaka for 2 minutes. It will get heated. Don't accept it. It will become red hot. Only the temperature will increase at the tip of the shalaka. See the patient face. Then how we are doing the Agni Karma. Fold the forearm at 90-degree angle. Keep the arm on the patient's leg. Then fold the upper arm with your left hand tightly. After identification of the pain area, that is the extensor muscle origin area at the lateral condyle of the humerus, that area is burnt thoroughly with a single pointer. That is the pointer type of pattern of Agni Karma is done. And this is the shalaka is a battery rechargeable shalaka. See the patient face. This is the stimulation, how deep we need to perform. That is very important. The next, this is the again the whole course of sciatica is involved here. See, this is a video especially we have made in a different manner. You can observe me. I am wearing a blazer, and this is a Panchkarma department, procedure department. We are into the function during this time, and the Panchkarma people referred the sciatica patient to the Shalatadra department since the patient has taken so many medications and so many procedures of Panchkarma, but the sciatica pain has not reduced, and they have referred the patient to the Shalatadra department. So I came directly from the function to the Panchkarma department. Wherever the materials are available, that is gas, cylinder, everything, I am not disturb the patient in that particular area only. You no need to have a OT type of setup for doing Agni Karma. No need to go for scrub area or scrub dress. Doesn't require for doing Agni Karma. It's very simplest procedure. Anywhere, any place you can perform. That is a freedom what Acharya Shuddha has been given, and the same thing we are following. The patient cannot wait for such a things. Immediately, wherever it requires, it can be done. So the shalaka is fitted here. This is the swastika type of pointer we have fitted to the shalaka. You can see here, and the whole length of the course we have done the Agni Karma in this case. So it means anywhere if you are available in that particular area or situation, you can perform the Agni Karma. No need to have bigger setup. No need to go for the any type of preparation. Only the interaction with the patient is required, and the convincing the patient is very important. When the patient is convinced, accepted your procedure, see the procedure. The pointers are Agni Karma pattern is different. This is the swastika type. Only selected the pain points we are doing here. Very less amount of scar, and the wound will be there. Very zoom. You can see here the swastika type of only 4 to 5 points we have given, giving bigger gap between the each there is a wider gap is there, and healing will be occurs very fast. That is very important. That Bindu Pramana will be having very closer each other, but in case of other like swastika and Astapada, wider gap we can give here, and multiple areas can be covered, and the bigger areas also can be covered with a different type of pointers. So this is one, in one sitting only we are doing 2-3 areas. This is one area at the lateral part of the gluteal region we have done. Then again the shalaka is kept heating, and the second area, that is the thigh region. The already black marks are we have marked here. So this 1, 2, 3, 4, the whole length of the lateral part of the thigh is covered by swastika type of pattern of Agni Karma. Okay, so here if you are selecting Bindu Pramana means it requires multiple areas or multiple pointers we have to perform here. That may make the bigger wound, and that will take a lot of time to heal. So this is how the different types of shalaka pointers we have made according to the need. We have to change. It requires little bit mental knowledge and the skill. When you are into this procedure, you will understand what type of pointers we have to select, and how it can be performed. Okay, so this is one of the small example of the same case of sciatica, how it can be handled or managed by the different pointers of Agni Karma Shalakas. And this is extended Agni Karma, that is the lateral part of the, like already the first sitting, the many pointers we have given here Agni Karma with the Bindu Pramana type of. Again, the posterior part of the lower part of the leg, the patient is having pain. See here, any number of pointers or patterns we can perform here. Only thing we have to remember, the post procedure wound care is very important, and there is a gap between each Bindu Pramana, very clearly demarcated here. You cannot overlap each bindus. That will become a bigger and wider injuries. Okay, wounds that will not heal properly. So that is very important. This is cervical spondylosis, lady patient. Even the procedure can be performed in case of the soft people like ladies and the even the younger generation. So these are the different types of patients we have selected, and that can be done. Okay, see the pain points I am identifying with the pen marker. The area is marked first. Just watch the procedure completely and reaction of the patient during the procedure. How much deeper stimulation it requires each procedure or each disorder. That is very important. First is most important is convincing patient and then marking the pain areas. Okay, there is no restriction, and you cannot get the reference in a text to that particular in this area you have to perform. The Shushata has given a free hand regarding the pain management. That particular pain area, it is depends upon you how what the skill you are having regarding anatomy and the physiology of that particular structure. So keeping the marmasthana and vital parts, we have to identify. See that area is identified, and the neck region and the upper part of the shoulder, the Agni Karma is done. See the reaction of the patient. This is a Bhakti Shalaka. Don't stop it, or keep talking with the patient, and the whole area has to be covered in one sitting only, because if you stop in between, the success rate will become very less. Continuously keep talking with the patient, and the area has to be covered in one sitting only. That is very important. See, there is no restriction for me. With a free hand, I'm totally doing the covering that area wherever the patient says the pain is more in the cervical spondylosis. See, this is the post procedure like the runas. So this is very important. After this procedure, no handling and taking care of the wound is very important. If it is taken care properly, definitely the successful rates will be increased. The next is also sciatica. Then we will go through the calculus for how deeply we do the Agni Karma. So here, no, the fat tissue will be thicker in size, and the skin also very hard in this plantar aspect of the heel. You need to stimulate a little bit deeper than the what videos you have seen earlier, because that is the thin skin will be there in other, like in the low back and the cervical area or in the gluteal area. But in the plantar aspect, no, the heel, see here the deeper, somewhat the maximum time I am taking here for each bindu for 1, 2, and the deeper stimulation it requires here. The gap you can see here. Give a little bit pressure on each stroke. You have to have more pressure, so that has to go a little bit deeper here. Already patient has taken on the left side and the same sitting, and we have done on the right side. It means both leg can be done at one sitting itself. No need to have any fear in the mind. Patient can walk immediately after the Agni Karma procedure. Okay, so that is the one of the different techniques. How deeply strokes has to be given during the management of calcaneus spur. And this is one of the different procedure what we call Agni Karma. It requires a very different materials like Yerenda Patra or Vedana Shamaka, any type of Vedana Hara Dravyas can be taken here, Nirgundi Patra, Arka Patra, Chincha Patra, whatever available drugs are there that can be taken for the Snigdha type of Agni Karma. Here you are not burning any structures, only deep heat is transferred to a particular pain areas by application of this material. Okay, how it is performed, I'll show you. This is the chopped Yerenda Patra is fried with the Vatanashaka Thailas like Dharmantri Thaila, Mahanarayana Thaila, completely very deep fried has to be made here. And these, whatever the deep heated fried, the leaves will be collected into a bigger leaf, and that leaf is made like a pottery, and that pottery is applied to that particular pain areas with the pressure. Okay, so that is 1 or 2 times we have to apply and see the reaction of the patient. It is a little bit different than the Patrapinda Sweda. Patrapinda Sweda is seen in the Panchakarma. You can see here the reaction of the patient and the procedure method of the procedure. Palpate the pottery and already identified the pain areas. See the patient jerking. See, so that stimulation is required here. And take care of the, you should not burn that skin that will become boil if you are not taking care of that particular patient. So this is very beautiful. The deep stimulation is there. Maximum heat is transferred to that particular pain areas when the patient is not accepting your routine Ruksha type of Agni Karma. If the patient don't want to have scar or don't want to accept that Ruksha Agni Karma, then this is the very mild and very different technique is there. This also can be performed, and we call it as Snigdha Agni Karma. Okay. And during COVID-19, how we can perform. So all these patients, what I have shown, we come in contact with the patient very closely, and more of the maximum time patient will stay with us, and it's a very dangerous situation. We cannot suspect and assume that who is having the virus in their body and who is not having. And many a times we afraid and we run away from the treatment procedures when we are dealing with the suspicious patient. Okay, even the normal person also, the common man is also having fear coming in close contact with the normal person. Then how the Agni Karma can be performed during the COVID-19 pandemic? So we have done the same thing in the hospital. Till today, we are doing it with precaution, like very minimal stay of the hospital in the patient in the hospital, and very less contact with the patient is it requires. That is one of the best method to overcome with the pain of the patient. Like patient to see wearing the mask, and we are also wearing the mask and the gloves, and the patient will stay for a few minutes with us in the department or in the MOT procedure room. And patient party or patient will also have afraid to undergo for the Panchakarma procedure, because they will doubt on the Panchakarma procedure therapist, as well as they will not stay in the hospital for longer period. This is the traditional shalaka, which is heated on the gas stove, and that will be applied to that particular pain areas in the tennis elbow. So the patient is called for the follow-up again for the same thing in the next video. See here, same patient has been done in the second sitting. Okay, so again we have taken care for the mask and the gloves to overcome with the COVID-19. We never stopped the procedure even such a situation. So the Panchakarma has stopped, and the other procedures also stopped, because the therapist will comes in contact with the patient, and patient will stay for the longer period in the hospital or the procedure room. So that will become a bigger issue, and everybody will be having the fear of contact of the COVID-19 situation. So many a times the people and the patient himself, they will avoid coming to the hospital. but you have to give assurance to the patient that you can stay for minimum time in the hospital, and you will not come in contact with the other unhealthy people in the hospital, and immediate of the procedure you can go out of the hospital. So that is very important for the pain management. So this is the one of the advantage for those people who are practicing Agni Karma. Okay, so this is the third case, third patient I will show you. This is a migraine patient. The patient is wearing mask and the eyes will be covered, and the pain area is selected here. And we know very well patient is known case of chronic migraine patient, and they don't want to undergo for Nasal Karma or any other Shalakya or Panchkarma procedures in the hospital. They are afraid to stay for longer period in the hospital. So we convinced them to undergo for the Agni Karma procedure. Then they accepted it, and we have done Agni Karma, and we have got good result for that. So this is the one of the chance for the Agni Karma people to enhance their capacity and spread their procedures among other people, those who are not accepting or those who don't know, unaware of the Agni Karma procedure. So this is the migraine or Ardha Vedika patient. This is a battery chargeable Shalaka. We are also wearing the mask. Patient also wearing mask. Very less contact with the patient for a few seconds. Few minutes will be there in the hospital. See the reaction of the patient. Then immediate after the procedure, no, we'll do the dressing and we'll ask the patient to go home. So this is how the situation is handled according to the guidelines of the central government and the state government. And keep yourself treating the patient 24/7. Don't run away, and patient also should understand what is the situation. This is also one of the best video. We have treated that sciatic patient even in this condition. See low back already the Agni Karma is done, then gluteal area, thigh region, then the calf area is marked here. The first area is covered in the low back, and second sitting, no, the three area is totally marked. So these three areas will be done in one sitting, even during COVID situation. So only for 5 to 10 minutes, patient will stay with you in the department or in the OPD or MOT department, and you can perform the procedure and send back patient to home immediately after the procedure. Just watch the video how we have done. So this is our Shalaka. Dr. Arjun is Agni Karma Shalaka, and we have done this procedure with the Astapada type of pointer we have selected here. So this is our place where every day we do the Agni Karma MOT. And this is the handle, wooden handle, and this is the bar, that is the shaft of the Shalaka. And then at the tip of the Shalaka bar, we have to place the tighten the pointer, that is the Astapada type of pointer we have selected here. So wearing mask and everything, taking care, we have done, we are doing every day the Agni Karma procedures in our hospital. So it will be get heated on the normal stove. Just to watch the video, and these are the materials kept aside. That is the post-operative care, Haridra Churna, and then a cloth bandage and the whole tape is there. See, this is Astapada type of Agni Karma. At the low back, we have done with the Bindu Pramana, and these three areas we have selected. Only 1 or 2 applications we are doing here to minimize the scar and minimize the wounds for the post-operative care, post-procedure care. Okay. So Astapada is selected here. You can, we'll zoom it. You can see the design how it will comes after the procedure. See, this is the round Astapada type of burns will be made in that particular area. Here you can see 8 bindus will be there at one sitting. Okay. So this is what I am saying about the book, textbook, small handbook will comes. So this is my conclusion. So I am going to end my session. So Agni Karma procedure is practiced since the Vedic period because of its versatility, treating many of disease, mainly because of property of the roga and Apunarbhavatva. So open nerve, the reoccurrence is not seen in once the patient is treated with the Agni Karma procedure. The Agni Karma can be practiced in a minimal OPD setup level, as I'm saying. As I said, no need to go for bigger investment. It's very economical, very small setup with very few instruments. The Agni Karma can be performed even in the OPD level. In many diseases, the Agni Karma should be considered as a Purva Chikitsa, as in Kadara, Charmakila, Parikartika, etc. So some people say the Agni Karma is the post-operative care or the supportive procedure during the others major surgeries. But we are telling in case of like Kadara, Charmakila, Parikartika, such a disease, Agni Karma is the main Pradhana, as a Pradhana Karma. It has to be considered as Pradhana Karma. Okay. Then Agni Karma also considered to be an associated treatment when used for the purpose of Rakta Stambhana. For hemostasis, the Agni Karma is used like a hot rate, and so there we can consider as an associated treatment. Then usage of NSAID, analgesic drugs in the pain management is often associated with a lot of many side effects, where the Agni Karma is a potential mode of pain management free from such side effects when it is performed ideally. So we have to educate the patient regarding the side effects of NSAID or analgesic drugs or medicines, and accept them the Agni Karma procedures, which does not have the side effect, and it has a very good modality of the treatment method, and it's a wide effect of Agni Karma post procedure that has to be educated to the patient. So these are the few more things we require to work on Agni Karma in day-to-day practice, being an Ayurvedic doctor. And even in the COVID-19 situation, being an Ayurvedic practitioner is very difficult to practice Panchakarma in case like Griva Shula, Katishula, Janu Sandhi Shula, Grudrasi, migraine, because all these diseases requires the bigger procedures of Panchakarma, and patient will stay longer period in the hospital or in the Panchakarma procedure room. So there the contamination will be more, chances of contamination will be there, question of doubt will be there, and sometimes patient also will not accept staying longer period in the hospital. Then how these problems will be solved or attended means it is with the help of Agni Karma. This type of pain can be controlled or can be brought down with the help of Agni Karma. Okay, that is very important, because in all these procedures, patient will come directly, contact with us directly, and also our helping staff will also comes in contact with the patient. That is very dangerous. To avoid all such a situation, the COVID-19, even in the COVID-19, we can perform Agni Karma with a small taking care of the guidelines of the government. Okay. And the last one is Agni Karma is very simple, effortless procedure for pain management. There is no need to break our head. Only you need a little skill and the practice 1 or 2 times. Once you do the Agni Karma, third time you will become master in that. Okay. So this is all about my whole presentation and my experience regarding the Agni Karma procedure. Even this Agni Karma procedure can be practiced during this pandemic COVID-19. And this is my last slide. I would like to thank everyone, including Swamiji and the principal sir and the dean sir, then the HOD of the Shala department, Aradhya sir and Ayana sir. Thank you very much giving me such a wonderful opportunity to share my knowledge and share my experience regarding the Agni Karma. Okay, thank you everyone. Thank you all. If anybody has questions and the doubts, they can go through the organizer, and I will get back to you immediately on this webinar online. Sir, Ayana sir, over to you, madam. Thank you very much.
Sir, shall we take a few questions? Sir, can you please explain long-lasting result of Agni Karma even though it is applied locally? So it is like.
Hello.
Sir, am I audible?
Madam, Anush, ಕೇಳಿಸ್ತಾ ಇಲ್ಲ?
Sir, can you explain? Now audible, sir? Hello? Sir, am I audible? Am I audible?
ಮೇಡಮ್ ಒಂದು ನಿಮಿಷ ಕೇಳಿಸ್ತಾ ಇಲ್ಲ. ಹಲೋ,
Can you please explain long?
ಹೇಳಿ ಮೇಡಮ್.
Sir, can you explain the long-lasting result of Agni Karma, even though it is applied locally?
In which conditions, madam?
Sir, in general conditions, I think the question is like, how long the result will be lasting in pain management?
In pain management, usually it depends upon the pathology. If any pathological deformity is not there, only one sitting or two sittings are required. Once it is done thoroughly, no need to go for the second and third sitting. There is no need to go for the follow-up. Okay, once it is done thoroughly, there is no requirement of the second follow-up, madam.
I think that question is clear, sir. Is there any criteria for selecting any particular pattern in Agni Karma? Is it based on the severity or location or like tok or mamsa, snayu, etc.? In the slides, you have shown that.
No, nothing. It is our experience only. Day to day, whatever we have done last 20 years, we have done research work, trial and error in different disorders with the different patterns. So this is our conclusion, what we have made. Okay. So this is, we want to share with everyone, those who are willing to, wishing to practice Agni Karma, because we want to clear the doubts, clear the confusions among our Ayurvedic people. So this is the basic steps we have made. Apart from this, if you want to practice in different style, different pattern, it's a very free hand to practice anybody, anywhere. Okay, this is what we made, and we have come to a conclusion after the maximum period of research work, and there is no reference for this.
But it's really great, sir. I think the question answer is clear. Pariksha Kehi Bhagavidam Pariksha. So it's sure that we can apply as it is enriched with your knowledge. Sir, one more question. Sir, about the Samyak Dagda Lakshanas, how it will be effective in Gridrasi, where Snayu Kandaras are mainly involved?
No, only
because
the
we are
pain management I am talking. So Snayu Kandara is involved in the Gridrasi, but we are concentrating on the course of the sciatica nerve, the whole course of the sciatica nerve involved in the pain. And even if you are palpate the pain areas, no, patient will tell that particular highest point of the pain areas. Okay, so that pain areas can be controlled with the help of Tachagata level Dagda. If you are doing the deeper structures like Mansa and Kandara, then the post procedure management will become very difficult, and it has to be taken care thoroughly, and the patient has to be admitted in the hospital. So what we are doing, we are on the OPD base, hospital OPD base, we are treating the patient, and we have got good result. 100% when you are having good result, then why you are taking a risk, making a bigger, deeper wound, and after making wound, again we have to go for the wound management. But in case of, see, if you are doing the deeper Mausagata and Kandragata Agni Karma, if the patient is diabetic, then what you will do? You will avoid. So it is better, it's the safest method. Even a patient is diabetic, even a patient is hypertensive, if the patient comes with a sciatica, we do this Tvachagata level Agni Karma, and that post procedure Runa management is very easy, and that can be pain can be controlled only this level of Agni Karma. When it is controlled by Tvachagata, then why you are going for the deeper structure? And definitely it is contraindicated deeper structure level Agni Karma in case of diabetic, in case of cardiac patient, in case of hypertensive patient. But all these patients, Tvachagata level we can do, and we are doing it. My wish and my suggestion is you just to go ahead with a superficial therapeutic burn, and you will be having good result.
Sir, and thank you, sir. Another question, sir, whether the marks, scar marks are permanent with
No.
any measures to reduce the scar
No,
marks?
no. It is not permanent. It will become the normal skin color over a period like 1 month or 2 months. Beginning, it looks like white color once the wound get healed, and later on, after 1 month or 2 months, no, the white color, whatever the round patches are there, that will become normal skin color. There is no doubt at all. Yes, madam.
Sir, Whether one delegate is asking whether butane gas is safe to use.
Everything is safe, madam. Butane gas. See, instruments, when you are using scalpel in the surgery, it's very dangerous when it fall down on your leg. Okay. So in the same manner, Shishita has told how to handle the instruments, whether it is a sharp or whether it is a blunt. So butane gas instrument, if it fall down, it will burst like anything. So that care has to be taken being a surgeon.
Thank you, sir. I think that question is answered. And sir, many delegates are interested to have your Shalaka, sir. They are asking how they can order or how they can get the price and all, sir.
Madam, you can share my number to that group or anywhere. They can contact me. I am in the WhatsApp, I am in the Instagram, and even in the YouTube channel, they can interact with me. And those who are actually those who are want to practice Agni Karma, if they are sitting somewhere else in the northeast or in the northern part of the India, they can call video. They can make video call. Through video call also, I will guide how with the patient. If they call me, I will guide them how the Agni Karma can be performed. This is totally effortless. This is totally feeless. And when we were in the student life, there was no teachers and gurus. We found teaching like online. Now we are here. We can teach the people online also. And no need to sit at one place and learn the Agni Karma. You call from your end in video call. I will teach you, or I will share my ideas to make easy the procedure. Okay. So you can share my number with people, those who are interested to gain the knowledge of the procedure and about the instrument, madam.
Okay, sir. Thank you very much, sir. Because of time limit, we are stopping the questions.
Okay,
Sir,
I think I took a lot of time.
Okay. Sir, I extend the sincere thanks on the behalf of Anushastra 2020 for your valuable session. You demonstrated many videos. Your shalakas, you have shown how to do that. Everything, each and every aspect of Agni Karma has been discussed here. Not only pain, but with specifically pain, different aspect you have discussed. We are very much grateful to you, sir. As our principal, sir, Sarveshwarkar, sir, given his special thanks on behalf of the institution to extend to you, sir. Thank you very much, sir.
Thank you, madam.
Now I request Dr. Vivek, Assistant Professor, Department of Shalakya Tantra, to conclude the session. Over to you, sir.
Okay, madam.
Namaste to all. I'm Vivek, Dr. Vivek GK, Assistant Professor, Department of Shalakya Tantra, JSS Ayurveda Medical College, Mysuru. On behalf of our institution, JSS Ayurveda Medical College, and Team Anushastra 2020, I would like to thank our resource person, Dr. Santosh Kumar Arjunagi sir, for sharing the knowledge, his clinical expertise, and all the videos related to Agni Karma. We are very much fortunate enough to hear to your words and to watch your videos, sir. Thank you very much for taking time or making time for us for this program. Thank you very much, sir.
Thank you, sir.
Dear delegates and respected faculty members, we'll be getting back to you with the oral presentation by 2 p.m. today. Be ready with that. Thank you. Thank you, one and all.
Okay, sir.